Hi everyone, can we have one last mic check? Can you confirm if you can hear me? All the way back? Okay, great, lovely. Hi everyone, good morning. Welcome to the first ever conference that has been jointly hosted by OP Jindal Global University and Social Policy Research Foundation. We're so glad that you could make it here, the participants especially, and thank you for bearing with the delay. It's just to give you an indication of what Social Policy Research Foundation or SPRF is. We are a non-partisan public policy think tank, which is headquartered in New Delhi. And we conduct independent policy research to create open data sources, which is very important to us, open access to knowledge. We also undertake not-for-profit commissioned research for idea and feasibility mapping. And lastly, we suggest policy pathways and recommendations to government departments. What we essentially do is horizontalize and intersectionalize public policy and take it out of the academic silos and bridge that gap between traditional policy think tanks and academic research to make it more accessible to people like you and me and people beyond us who might not be subject matter experts or in fact have interest in the technicalities and jargon of public policy. We are thrilled to have you with us today. Again, thank you for being here, and we're so grateful to the administration and the people at OP Jindal for hosting us today and for being such supportive partners throughout this endeavor. The theme for the day is social protection and security in India, present challenges and discussion for the future. So while in terms of theoretical stance, it's social protection and security, which again is also the policy stance here, I think what is important to look at, and the point of discussion here, is the part which talks about present challenges, but also discussion for the future. So what is amiss at the moment, what can be done to make sure that security, social protection and security in India is as foolproof as possible and as beneficial to the necessary people as possible. So social protection and security measures constitute a crucial part of the national social policy orientation as they ensure that the poor and the vulnerable receive socio-economic and nutritional support during times of stress and economic shocks. While India is globally recognized for large-scale social protection measures, concerns remain regarding implementation challenges, the politicization of benefits, socio-economic discrimination amongst welfare recipients, and again, how future-proof and how foolproof are such policies. An emerging debate in the realm of social protection and welfare in India lies in the conflict between productive and protective social policy making. There have been discussions on how India needs to incorporate a more productive social policy to create skilled workers and jobs and ensure that the vulnerable do not ultimately have to depend on social welfare measures. However, again, as we know, protective social policy has proved crucial in ensuring that adequate nutritional uptake, decent work, access to civic services such as electricity and other essential needs are met for the most vulnerable in the country. In such a context, the conference discussion takes an inter- and interdisciplinary approach to analyzing social protection and security in India along the axes of identity, informal economy, health, and more, with a strong focus on answering questions that can shape public policy discourse in the country. Today, we have 4 presentations for you, spread across 2 panels on pressing policy issues that affect some of the most vulnerable stakeholders in the social policy ecosystem. The presenters are students and scholars from a wide disciplinary spectrum, researching at reputed institutions like the University of Delhi, Jamia Millia Islamia, Shiv Nadar Institute of Eminence, and of course, OP Jindal Global University. To give you a brief outlay of how things are going to go, we will have 2 presentations on each panel, which will be 15 minutes long, followed by a 5-minute question-answer session. But again, I think since we have the time, the participants are at the liberty to extend it to up to 20 minutes. And again, followed by a 5 to 10 minutes round of question-answer session from both the evaluation panel and the audience as well and other participants. We encourage you to participate and ask questions. I think it's a great opportunity to just engage in discourse in the room itself and just learn and have a great conversation. The evaluation panel will consist of my teammates from SPRF. We have Yashroop and Fahad and I on the panel. And after the presentations, we'll have a quick panel discussion with Professor Milinda Chakrabarti and Professor Indranil Mukhopadhyay from the Jindal School of Government and Public Policy. That was all from me for now. I think it's time to move on to the first presentation panel with the first presentation, and I would like to invite Sanya and Ankush to present their paper.
Good morning. Are we audible? Right. So, good morning. I'm Ankush and this is Sanya. I am pursuing my sociology from Jamia Millia Islamia, and Sanya is pursuing her economics honors from Jesus and Mary, University of Delhi. We are here to present a paper on how social security schemes often bolster and reinforce caste and gender divides rather than alleviate them. Our paper is titled Exclusion by Design, Uncovering the Caste and Gender Bias in India's Social Security Scheme. Right. So these are the content of our paper. We have divided it into largely 4 parts, and there are obviously subheadings between them as well.
Throughout this paper, we draw on official government data. We have used National Sample Survey as well as official budget data to quantify the gaps in social security coverage for different groups. Here, I would like to borrow terminology from Khera's analysis of the old and current social security framework that focuses on the transition to a rights-based perspective on social security. We too highlight this particular need, and there's this dismissal of the pejorative expression of Mai Baap Sarkar, which is an outmoded form of governance where the stereotypical citizen is viewed as a supplicant at the state's feet and its benevolence. This form of government dictates the redistribution of resources as a generous move on part of the government without any consideration for the rights of the citizens. We have used this particular way of data analysis essentially to demonstrate the exclusionary nature at an institutional level in the India's social security system, which significantly reveals a lower access to social security benefits for marginalized social groups, particularly along the lines of caste as well, and gender. For instance, Dalits have lower access to basic amenities and also are more likely to live in poverty compared with other social groups. And similarly, women are disproportionately affected by the lack of access to social security benefits. So basically, we have kind of tried to bring out these systemic biases that contribute to these exclusionary nature of India's social security system, and also kind of reveal the structural issues that continue to be ignored on the public finance realms. So it is important to address these gaps. And looping in finally, again, the theoretical framework, we have built on the idea of intersectionality. It has been one of the most significant contributions to feminist as well as heterodox studies since its birth. We argue that overall intersectionality highlights the complexity and multidimensionality of worker experience in ensuring a life of dignity and gaining a sustainable income. And here, caste and gender are our identity markers. And after that, the official government data has been scrapped and extracted. As you mentioned, SPRF is also working to open the government data sources. that has been a good effort in terms of data governance in general, but our data has been particularly scrapped from PDFs, so it has not been a very convenient process overall. And it has then analyzed, and it has been analyzed and identified the patterns that kind of reveal the gaps in the nature of social security. And please do note that we do acknowledge that the official government data may not be the most reliable source in current times, and a lot of people within the academic realm have begun to question the legitimacy of these numbers. So having covered all of that, we will move to the first bit.
Right. So the first bit is neoliberalism and welfare. So over here, we have further divided this topic into 3 subtopics, which is the historical context, where we talk about how neoliberalism actually cemented its footholds in not just, like, we won't focus on the world economy, obviously, that's a large aspect. So we'll focus on how it came into being in the nation, how neoliberalism actually gained prominence. We will then talk about informalization and its impact on social security schemes as well as society at large. And finally, we have offered an overview and critique of the general and new welfareism. Right, so historical context. So coming to historical context, neoliberalism is, mistakenly directly correlated with the new economic policy 1990. So we are not saying that it was not neoliberal in nature, it really was. But we have to see that anti-worker policies are not really something that came about to be in the 1990s. So there is often this misconception that prior to the 1990s and the neoliberal schemes which came in, when Manmohan Singh was the Prime Minister, that there existed a socialist era where workers' rights were protected. So to dispel that myth, we have to go back a bit, we have to go back in time a bit before independence. So during the 1930s, the Indian National Congress formed a provincial government in Bombay Presidency. So prior to them forming a government, they presented an image to the British colonial government that, if the British leave, there's not going to be any problems. Like, you are the only problem we have. Other than that, there are no internal conflicts. But that was proven to be false when they actually had to govern. So Gulzari Lal Nanda, one of M.K. Gandhi's trusted aides, who also became the Prime Minister for 2 terms simultaneously, the interim Prime Minister, was considered as the architect behind the, the architect behind the trade dispute bill, also the Labour Act of 1938. So the Labour Act of 1938 is a very comprehensive bill, but we will just focus on one point for this paper, which is that the bill deemed strikes as illegal, right? And if you did conduct a strike, you were bound to be imprisoned for 6 months. So this was opposed by this was obviously opposed in the assembly by Ambedkar's Independent Labour Party, the Muslim League, as well as trade unions. So coming to informalization and its manifestation within society. So India obviously has a very significantly large number of a GDP. It's a very huge percentage, right? But most of it is contributed to by the informal sections of the society. However, we often understand informal sector as something that's not directly in purview of the public sector. But if we actually analyze it in a micro sense, we have to also consider the fact that even state-run corporations are informalizing certain jobs. Let's say security guards, they're outsourcing it. So the reason why, it's commonly understood, and also we agree that it's because it does not really, leave them with the responsibility of coming up with a fixed wage, as well as not really bothering to provide social security schemes since it's outsourced. Right. So coming to the general critique of welfareism. So welfareism, the idea of welfareism is let's go back to UPA, sorry. So UPA, the UPA government introduced Aadhaar as a means of making welfare schemes more accessible, so that you could access welfare schemes. However, the Aadhaar has rather proven to be an obstacle rather than making it easier to access welfare schemes. So the Aadhaar comes with a very complicated process that is a completely different debate. Other than that, there have also been issues pertaining to how Aadhaar has multiple loopholes, like technological glitches, as well as security issues. Even if you consider the current NREGA workers' protests, which have been going on for about 2 months now, one of the major demands that they have is getting rid of Aadhaar-based payments, as well as the app, the NMMS app, which is National Mobile Monitoring System. That's one of their primary demands. So what the Aadhaar enabled, so according to multiple activists who work on ground. What Aadhaar does is if you look at the bill, the Ministry of Rural Development released a notice in late January saying that payments will only be given to those workers who have an Aadhaar linked account. However, on that very day, the ministry's website, according to the data there, more than 50% of the workers did not have an Aadhaar enabled account. And the ministry gave just 2 days for people to get in line. And we all know how getting an Aadhaar enabled account is very difficult, and the government expecting this from people who are daily wage laborers, especially when the government is, in fact, the finance minister claims to boast of an inclusive budget where they claim to take care of everyone, while most of the people dependent on Narega are people who come from the margins, like a significant portion of it.
Okay, moving on to the next section. It has been dealt with in 3 parts. Again, bringing in the question of caste, thinking of employment through a gendered lens, and finally, looking at the budgetary allocations, that is our public finance angle, for all, the select schemes that we will be bringing out in this paper. We refer to some select schemes throughout this paper. We will show that in the coming slides, and we have tried to see the trends across years. One of them is Narega, of course. In the case of Narega, which is started as a demand-side program on the premise of self-targeting, those who seek work shall receive work, has ended up being played on the whims of the state's supply-driven factors, meaning that when funds are available, the government opens the work sites and posts job openings. So here the table shows the average employment days reported under Narega and the low levels of the average number of days per household provided under Narega in India, and why it is a cause for concern. Despite being one of the largest employment guarantee programs in the world, the number of days of employment provided to households under the program falls well short of the 100 days of guaranteed employment per household per year, which is the mandated minimum. Not to mention that the evident stagnation that there is in these numbers across the years. This has resulted in a situation where many of the poorest households in India are unable to benefit fully from the program, leading to a persistent poverty situation and, of course, said exclusion. It is important to address this issue and ensure that the program is implemented effectively to provide adequate employment opportunities.
Right, so next we address the question of caste. So, it's often considered that affirmative actions, that's the common belief, which even for some reason is popular even among academic circles, is that affirmative action policies take away most of the employment opportunities. But as we all know, affirmative actions are only for public sector employment, and which, as we already discussed, is not, does not exceed more than 7% of the total workforce. And even when you talk about the private sector employment, a study was undertaken by Professor Paul Atwill and Professor Sukhdev Thorat, where they noted that a Dalit and a Muslim applicant with equivalent qualifications to an upper caste Hindu applicant has much less chance of getting a call back. And the only difference in the applications lied was their name, which gave away their religious identity, obviously, and also the caste identity. So when we discuss caste, we further go into data and we figure out that, as we already discussed about Narega, the numbers increase approximately from 5 lakh for both SC and ST to 17 lakh for STs and 14 lakh for SCs, an average of 200% increase in both groups. Although the growth was preceded by a period of stagnancy from 2014 to 17, post-COVID studies show a complete trend for SCs and STs alike, undoing more than 6 years of growth in a matter of fewer than 24 months, with an average of around 40% decline per year during 2021 to 2023, compared to the average growth rate of about 30% per year from 2014 to 2021. In the overall picture from 2014 to 2023, the fraction of rural families completing 100 days of employment under Manrega has been anything but consistent, with the variation going as high as almost 100% growth from 2014 to 2016 and in 50% decline from 2021 to 2023. The alternating patterns between growth and decline show that the period of inconsistent growth are likely followed by periods of equally worse reversion. This indicates an unstable and stagnant family participation in completing the 100 days of employment offered as part of the Narega scheme. Right. So coming to employment and gendering employments, the disadvantaged situation of working class women has been made worse by the pervasive disparities in the labor market and the feminization of um, labor, care labor, compounded home obligations, and paid employment. Many factors such as rising economic growth, rising education, raising the marriageable age, macroeconomic policies, like focus on providing opportunities for women specifically, and general employment opportunity and social measures, domestic duties, etc., influence women's participation in the workforce. Cash for work programs like in India's Narega, which sets quotas for women and seeks to increase women's participation, were frequently used to address barriers to accessing the labor market. So even if you speak to, let's say, women who have been part of the Narega scheme, who have actually worked under the Narega scheme, they often talk about how Narega made things easier for them in the sense that they had much more financial independence. In the sense that Narega would directly, because working under Narega would ensure that the wages were directly transferred to their bank account, while they had to depend on the men in the house to get access to money before. So in that essence, Narega broke the dependency of money on men. Things are bleak on the rural gender landscape as well, with a striking difference in participation in the labor market between males and females. More than half of the rural male legislation is available for work, while the numbers go as low as less than a quarter for rural females. A deeper study of the socio-cultural factors involved in the participation may be fruitful. So according to Ministry of Rural Development portal data, the employment generated for women under Narega has decreased in recent years. In 2014 to 15, Narega generated employment for 312 lakh women, gradually increasing to approximately 38 lakh women in 388 lakh women in 2017 to 18. This trend continued a gradual increase in the subsequent years and saw one significant dip in 2021 to 22 and further in 2022 to 23, with the number of women employed under Narega declining to 551 lakhs in 2021 to 22 and 461 lakh in 2022 to 23.
Next scheme that we want to shed some light on is the National Creche Scheme. Now, please note that the including this allocation of National Creche Scheme twice in our paper just underscores the importance of addressing the needs of working women, both in formal as well as informal sector. So the lack of access to affordable and safe childcare facilities is a major barrier to women's participation in the labor force. By providing creche facilities, the National Creche Scheme can help alleviate this burden and enable more women to participate in the workforce, which in turn can contribute to economic growth of the country, right? So the funding for the program, as seen in this graph, has declined according to a report by the National Commission for Women in 2018 from rupees 133.02 crores in 2015-16 to rupees 17.60 crores in 2021-22, or roughly just 0.000074% of GDP, quite low. And comparatively, in the same year, the budget for defense was about 2.29% of GDP, while the budget for education and health were about 3.1% and 1.4% of GDP, respectively. Finally, having talked about funding a bit, this is a more comprehensive angle to public finance. The social security schemes show a downward sloping or sort of a stagnant allocation trend across these select schemes. We have the Narega, we have umbrella ICDS, the Anganwadi services, we have the National Program of Midday Meals in Schools, we have the National Creche Scheme as already discussed, we have the umbrella scheme for development of scheduled castes and a similar scheme for scheduled tribes. So these are the broader heads that you would find in the budget document. So as mentioned, yes, one thing that I do want to point out is that the Indian government's decision to combine the Integrated Child Development Services, that is the ICDS program, one of the most comprehensive social security scheme that ran in India, with the Saksham, Anganwadi and Poshan 2.0 programs, as well as the midday meal program, which witnessed an 11% decline from previous year's revised estimates. Now, several concerns about the need to ensure the execution of these programs is streamlined and practical with sufficient resources and infrastructure, and that the intended beneficiaries receive the benefits to which they are entitled are overlooked. The government hasn't been allocating sufficient fundings for all these programs. Although there is an increased budgetary allocations in recent years, there is a major loss in granularity in official government data. So essentially, what they are advocating in terms of transparency and accountability is actually kind of lost on actual government data. Having said that, if you look at the Poshan ICDS scheme that has been combined, earlier you would see Anganwadi services having a subhead and a proper allocation of how much of that particular scheme is going to Anganwadi centers, building them, maintaining them, or anything else in general, just the services, but that granularity is kind of lost now. Now, women and children from marginalized and disadvantaged communities must have equal access to these programs and obtain the benefits as they are due. Now, according to the Economic Survey of India, 2014 to 22, and the official budget data of India, these are the data sources that have been used to calculate this particular graph. The total expenditure on NREGA has been increasing steadily since its inception. There was a dip into 2013 and 14, and then an increase again in the subsequent years. Now, the NREGA expenditure increased from 0.4% of GDP in 2014-15 to 0.5% in 2019-20. However, 2021-2022, Union Budget of India allocated rupees 73,000 crores to NREGA. That was a 34.5% decline from the revised estimates of 1.11 lakh crore in the previous fiscal year. Now, this could significantly, of course, impact the percentage of GDP expenditure on NREGA for the current fiscal year also, though the exact percentage would depend on the GDP numbers that are yet to come. Now, despite being frequently mentioned as one of the India's most significant social policy interventions in public discussions, NREGA has rarely ever surpassed the costs of 0.5% of GDP.
Right, so to conclude our entire paper and presentation, so we just want to highlight how there is often a disproportionate expenditure towards specific communities. Let's say if you consider the scheduled caste and the scheduled tribe communities, the government spends less than 0.05%, even though they contribute for 26% of India's population. And this is, I am pretty sure the data is not, because they haven't really done the census since 2011, so the numbers could have gone up when it comes to population. Similarly, this is actually in stark regards if you consider the fact the government is often going out of its way to claim to have an inclusive growth. But if you actually look at the schemes they are getting rid of, let's say Maulana Azad Fellowship for Minority Students or the Metric Scholarship for SC/ST OBC students, you actually see that communities that are already disadvantaged have very little to rely on when it comes to, let's say, higher education, and even those schemes are being taken away. While, right after taking them away, the government, while releasing the budget, claims to have an inclusive approach towards growth, but we are yet to see that yet. And another issue that we highlight is, let's say, digitization. So digitization, I mean, of course, digitization is something that the neoliberal government often preaches as, offering you better opportunities, more opportunities, not better, and that you can do multiple jobs, you can have work from home and all of it. But digitization comes with its own pitfalls, because with digitization comes the rise of gig economy. And gig economy is actually very convenient for the corporations, because they don't really have to pay you anything. They can pay you anything that they want and just label you as a partner instead of a worker. For example, even as we speak, the Blinkit workers are on a strike because their wages went from 50% per delivery, 50 rupees per delivery to 25, and now it's 15 rupees per delivery. And that is exactly why they have been protesting against the company for decreasing their wages. And as we all know, gig economy doesn't really cover social security at all. Right, so plus digitization has an even adverse impact when you talk about, as we already discussed, NREGA workers protesting. So NREGA workers, especially in, let's say, regions like Jharkhand, where electricity and mobile networking, no matter what the Prime Minister claims to be, is still very difficult to come by, is making it difficult because the NREGA scheme insists that you mark your attendance through something called the National Mobile Monitoring System, which is short, which is NMMS. And there you have to actually fill in an attendance twice a day with a picture of yourself. Failing which, if you don't do it twice a day, failing which your wage for that day does not get in, right? So let's say there is a network error because you have to fill it between 8 to 10 in the morning and after lunch sometime between 3 to 5. So let's say you do not have electricity or you do not have enough internet, the government doesn't really care. If you work, that's all right, but you have to mention that you were there. You have to make sure the attendance goes through, which is why many people have complained about working but not receiving the appropriate wage because for some reason the attendance did not go through. So the government really expects that when we have network issues in like metropolitan cities, that areas in Jharkhand will have it well. Right, so coming to India's lack of data protection, it actually makes things much worse. When you talk about Aadhaar-enabled payment, there is actually no dedicated data protection bill, which really tells you what data goes in, what data goes out, where it's stored, how often, for how long they can store it. So in that essence, it's actually much more complex because there has been several scholars and activists who have talked about how Aadhaar is actually an intrusion of privacy because it asks for data that may not even be relevant. If you consider the Arogya Setu app, for example, the Arogya Setu app started out as something that would, keep track of the disease as to how it's, commuting and where it's going, how it's traveling, taking note of the patterns, but it soon started asking for irrelevant details. I mean, it even asked you to upload your vaccine certificate. So the data is out there, and we have no idea where it gets stored, how long it gets stored for, or who has access to it. So in that essence, we think that it's not a gradual shift to neoliberalism anymore. It's rather a very steep decline towards neoliberalism because, and we don't believe in critiquing or reforming neoliberalism because neoliberalism is a government policy. We admit it. It's a government policy which actually acts out the will of the corporations. So if you really want to provide social security for the workers of the working class, then I don't see how we can reform neoliberalism because it's essentially a scheme that caters to the corporations at the expense of the working class.
That's it.
Right. Thank you.
So Ankush and Sanya, that was a well presented topic. So I just want to know, because you mentioned you actually gave a lot of historical context for neoliberalism. So could you elaborate on the need to make policymakers as well as the general public aware of the historical context of neoliberalism as well as the historical injustices and wrongs, and how can that understanding be sort of developed as a tool to make policies better for the upliftment of marginalized folks?
Do you want to take that up? Right. Okay. So when I mentioned the historical context, because we felt the need to do so because we often hear that the NEP in 1990 was the primary reason behind neoliberalism, and people speak of it as if before that it was a socialist utopia for the workers, as if there was no, workers' rights were protected and all of it. So D.D. Koshambi, in somewhere in his exasperating essays, writes about how basically Nehruvian socialism is a cover/farce for neoliberalism. So he talks about how Nehru uses the term Nehruvian socialism, but D.D. Koshambi goes on to elaborate, and he uses the phrase, which I am going to quote, he uses the phrase, the bourgeois comes of age, when he refers to Nehru. Right. So when you talk about it, the movement, even if you talk about the movement beyond India, there has been an undermining of trade unions or workers who have worked on ground from marginalized communities. Let's say if you consider, speaking about India only, if you talk about the 1938 bill, the 1938 bill essentially made strikes illegal, which are an essential negotiating power for the trade unions, because as we all know, all over the world, when the trade unions would not be met with fair wages or whatever their demands were, they would strike. They would bring the system to a halt, and there would be negotiations, and after that, if a result came through, then they would resume work. So when you make strikes illegal, when Gulzari, when he made strikes illegal, what he essentially did is he made the workers complacent. You know, you either work or you are put behind bars for 6 months. And being thrown behind bars for, like, let's say, us, it may not be as much of a problem, but for a working class person who lives on daily wages, it's a huge problem. And I mean, we think that making people aware of it cannot be done through like mainstream. As much as we try, it may not be able to, I mean, it could be an attempt in futility, because the mainstream will co-opt it no matter what. They will repackage a revolutionary movement to you as something that's aesthetic enough to sell. But we believe the only way to do it is, one of the only legitimate ways to do it so far is to take note of the mass movements which are happening on ground and to acknowledge them and to, not really treat them as isolated incidents. Because if you see, for example, since February, there has been the Narega movement. Right now, the blanket workers are striking. Then a few days ago, the All India Kisan Sabha led a march to Delhi in Ramlila Maidan. So if you see, the economy is impacting all of us at different stages, right? It's just that people who are impacted more are out on the streets. So I think the upper middle class has to get out of the delusion, which for that they have to really listen to the people on ground. Otherwise, I don't think there can be anything that, can be done.
Yes, and I think Ankush did cover most of it. But since you did talk about making people aware, I still think that's kind of, I mean, we can, of course, build a narrative around it, especially in institutions like of education, places like these. But those conversations are very, very rampantly squashed, even within public institutions, you would find. So I don't really think how this awareness would do anything other than cater to the reformist approach that is anyway kind of quite prevalent when we are talking about going against this wave of hyper-liberalization or going so much beyond into late-stage capitalism and all that. That's it.
Okay, I had a couple of questions. One is a little less fundamental, but if you go back to your slides on the budget allocation differences, right? I get that you're telling me this and the previous one. I get that you're telling me that the budget has dipped, and that's fair. But according to your analysis, what is the background, according to you, right? What do you think the context is for the budget allocation for, let's say, Manrega or for some social security schemes in this manner? Because I found that, like, I mean, the answer I'm getting is that the budgets are changing. That's fair, fine, they are. What is your analysis of why do you think, in your opinion, they are?
Just in addition to that, also, if you could cover how that reflects on government priorities in terms of different sectors within social security and social protection, that would also be a great addition.
Could you repeat?
Yeah, so just adding to Yashroop's question, how does that reflect the changing priorities of the government when it comes to different sectors and sub-themes within social protection and security?
Just to answer the budget bit, so I essentially find the realms of gender quite interesting for as my research interest. So I can say for the National Creche Scheme, for example, it's a very short answer, to be very honest. A lot of economists, feminist economists, someone like Sona Mitra, they have all brought out this problem of macroeconomic framework overall not having that gendered lens at all. So when you talk about gender budget statement, you would the National Child Welfare, Mother and Child Welfare Department would get allocated all of the funds. So it gets 80% of the funds that the government releases for welfare of women and of course adolescent girls and everything that that makes sense to the government as equality in terms of male and female bias. So what I here wanted to, I completely get your point that you do not get the context from that paper, and I think that is a limitation in terms of the upper limit of words, etc. We had to cut down on a lot of bits that we could have included. But just to give an idea was that, and also I will answer the priorities bit here only, because even though there is a lot of talk about inclusivity, so I sat through the entire 2-hour budget speech and there was so much talk about inclusivity, and I didn't find anything. So there was a scheme for adolescent girls, the saving scheme that was there. But other than that, there is not a gendered perspective, if you get what I'm saying. The concept that they're interpreting as equality in terms of, say, something like National Creche Scheme. The allocations have not just reduced a bit or stagnated. They have dropped. There is almost 0 creche centers in Delhi if you would find and go out. So someplace like Jharkhand, women actually carry their children on their backs while they are at their construction sites. So something like that, I don't think can come with just an understanding, oh, that the needs of women and men are different, and going ahead and a deeper analysis of care economy, you would find that a lot of the baggage falls on the women. So just in terms of National Creche Scheme, I think the priorities that have changed is that the government does talk about inclusivity without acknowledging what the actual population is going through. What are the real problems for the people who are actually working? The 1% who owns 60%, 50% of the wealth are not the real population that is giving us the real demography of the Indian population or the Indian people. Those are the, what you call the creamy layer, and even the 15% people who are just the upper middle classes. Other than that, there is no sort of mention of these people who are actually being affected by something like a social security scheme like the National Creche Scheme, or even the NREGA for that matter. Does that answer your question?
And the second one is a little more, okay, firstly, now that we are on NCS, can you tell me a little bit about what is the data that as a percentage of maybe work sites, I think that would be the metric, that shows the number of women with children at work sites, because that is not compared against the budget allocation. The budget's standalone allocation needs a yardstick, right?
Right.
I don't have a yardstick of the percentage of work sites distribution across states. For example, you're telling me Jharkhand, correct?
Yeah.
Okay. Can you give me, if you have, it's not, I mean, no pressure if you don't, but can you give me an indication of what the work site percentage is of places which have more than like if 5 or more children under 6 work alongside women? Do you have this data? If yes, then did you choose to not contrast it against the budget, or is it just that the data is not there?
I haven't looked for the data, so I am not sure if it's there. But this rhetoric that I was trying to put out is actually based on just a little bit of conversations with activists in NREGA right now who are protesting. So we were lucky enough to get in touch with a couple of them, and we did talk to them. It was just an informal sort of a conversation that it came up that women have no access and no sort of a facility to leave their children. So essentially, either, you know, right, it's the village children genuinely do not need a lot of care to look after. They just roam around, they're just there. So women generally just take them to these unsafe construction sites and just keep them around. But there's not a proper facility for these women to safely have their children along with them or even near them while they're at work. So having said all of that, no, I do not know if the data exists, and I have not looked at it, and I think that is a good addition if I could do that to my this paper only. I think this is something I felt with this graph as well, the households graph, because I wanted to contrast it with the number of households in rural areas which are eligible for NREGA, but that data does not exist. So something like that could have been better and made my point better, that if there are, say, 10 lakh families that are eligible for NREGA, only 5 lakh SC families are getting employment under NREGA, or something of that sort. So I think there are some problems and maybe some lacking on my part in terms of data, but I think that has to do a little bit about with the access to data in general. The MORD portal is not too friendly and it's not easy to navigate through, and we were on a time constraint also, so I think a lot of things have been missed out owing to a lot of technicalities. But yes, I think I can take your point into consideration into how these data can be contrasted.
Okay, Soumya, do I have 2 more minutes? Okay. Have you guys thought of any questions? No? Okay, cool. I'm just going to
May I add something to, right, so when Sanya mentioned about our conversation with Narega workers and let's say care economy in general. So I was working with an organization sometime between October to March with who were involved with the waste workers living on the peripheries of Delhi. So there's a dump yard nearby, it's Bhalaswa. You see it on the way from Haidarpuri metro station, right? So when you talk about care economy, in fact, apart from Bhalaswa, I also was there in Simapuri for a while, which is in fact the largest Bengali settlement, if I'm not wrong. So in Simapuri, when I was there sometime in December, slightly before Christmas or maybe after, I don't recollect. It was very cold, as we all know. So when we entered, it was about 8 in the morning, and we saw one of those cycle carts, right? Trash was filled, and the child was sleeping on top of it. The child would have been, what, 7, 8 months, and the mother had nowhere else to keep the child because, she was segregating the waste, and so she kept the child there, right out in the frigid winter at 8 a.m. in the morning. So that is what I think Sanu is trying to highlight when you talk about data. I mean, when you talk about informal settlements, there is also the fact that data is not easy to collect because a lot of them are scared about what really happens. Because if you consider, let's say, Simapuri, right? A significant portion of people living in Simapuri are Muslims, and not just Muslims, Bengali Muslims. So the rhetoric of, being illegal Bangladeshi immigrants works very well with the police. The Delhi police who are not able to identify between Odia and Bangla are, magically able to pinpoint that, this person speaking Bengali, but they have a Bangladeshi accent. So that rhetoric kicks in very quickly. So which is why people are often scared to go and register, right? So for a lot of schemes also, when they go, they have to face humiliation. So I think that is what Sanu was trying to point about, because care economy, and that's why a lot of women are not able to participate, or even when they do, it comes at the cost of, as I just discussed, a child sleeping out in the open in that frigid cold. It comes at the cost of the health of the children, right? So I think that's what I wanted to add.
Okay. Just the reason I'm asking, guys, is because, and I'm going to preface this by saying that being in public policy, the biggest caveat is we have to rely on data, which we had nothing to do with.
For sure.
Right? Sometimes we have to take that data at face value. There are instances where we can't take that data at face value, but a good thumb rule is let's take it at face value for the time being, at least. Right? Keeping that in mind, right? Let's look at the contrast we have. We are seeing significant, expansion of women in Manrega year on year, self-reported, with a degree of gender mobility within their pockets, right? That kind of opposes the idea that women, if in a child caregiving position, are going to then not opt into Manrega because of the services that are not there. And I think this conflict in the middle, and I'm not saying it's not a valid conflict. I'm saying as researchers, how do you address this gap? Because, and this is the last fundamental question I wanted to come to, is that neoliberalism doesn't happen because neoliberals neoliberate. It doesn't happen because people are neoliberal. That's not how it works, right? India has to juggle a federal structure, right? More often than not, a lot of these schemes, while built a certain way, depend on a complete different set of functioning. If I take the neoliberal, like the NEP into account, for all the liberalism that can happen, West Bengal took its own route, right? In the current sphere, Bihar and Jharkhand have taken their own route. We do have a central health mission, which is the Ayushman Bharat mission, which actually does have decent data, right? Which arguably then does come under decent social security coverage, etc. But West Bengal decided to then go with Kanya Sri or something, or Shastro Shati or something, which is diametrically opposed to this. The point being, we can either create better targeting or we can create better decentralization. How do you account in your analysis then that what do you think the basis for this neoliberalism is against the administrative boundaries of the state and center in India?
Okay. So, I will first come to the question of data. You're right. I'm currently also working with an organization that does exactly the governance bit for data, and they work with state governance and governments in terms of getting them to open their data sources for public finance, green procurement in general. And having said that, that is a good practice. But you're asking that if this data is to be contrasted with what was?
No, basically the way I'm looking at it is the data conflicts against each other.
Yeah.
Which
Right. So here, we're not currently just looking at the number of women. I mean, here we are because that's the limitation of data in India that is available. But we are also bringing in the question of identity markers that we're using. So if you're telling me that women who are actually getting up the ladder in terms of Narega only, are we looking at SC women particularly? Are we looking at Muslim women particularly? So even post-liberalization, I will take another religious identity, say being Muslim in India. So some place like Jamia Nagar, there is a study that was conducted. It was by a feminist economist again. I'm forgetting the name. No, I'm forgetting the name. So they argued that after neoliberalism, since the corporations were so blinded to identity, and identity was not a discourse anymore in the Indian narrative, Muslims found it easy to get a job. Muslims were just hands to kind of work and just labor. So it did not matter what labor, it was just labor for them, and that helped Muslims in a larger picture. Again, another study that my friend conducted in terms of oral history archives of Turkmen Gate, where the demolitions took place. This person, she first-hand interviewed, who said that he was denied admission in one of the prominent schools of Delhi, I cannot name, but they were denied admissions because the Turkmen Gate area came under the no admission zones because the Muslims were not. So you're talking about neoliberalism, all the good aspects of it. Yeah, there is economic growth, there is, but then I wish to focus even through this paper on the identity markers, as in could be very different for different demographies. For a worker in Jamia Nagar who's maybe a rickshaw puller, or maybe someone who's a security guard at a firm, was not asked if he was a Muslim before being employed as a security guard. Here, a child was denied admission to a high-profile school because he was a Muslim. So, I mean, there are different aspects to it. I get your point, I think, but the larger part of the question was, individually how neoliberalism affects people? Was it that? I can't comprehend it. Yes, yes, please.
basically, what is neoliberalism in one context
Yeah.
may not be enforced neoliberalism, and a lot of what the overarching Indian state does
Hmm.
has to keep in mind that the administrative boundaries become stronger in federalism because it can't enforce certain things on states.
But the federalism is getting diluted in today's time, isn't it? The power of the states. I'm asking you. I mean, aren't a lot of laws being passed by the center? No, I'm just asking. So, isn't that sort of a hegemonized way to look at the admin of the center or the union that is sitting? So, I mean, I'm not saying that neoliberalism is isolated to just the Indian context. It is a wave that has been going around the world. And now you are coming back to your protectionist ideas again, because we are turning inwards. We are looking at India as its, even USA, you are kind of drawing those tariff rates high up because every economy is trying to protect itself. So it's not that it's an isolated event that is happening in India, but I think it's a narrative that is across. It's like a cyclical change around the world. So, yeah. You are not convinced. But did I even answer? Was I even close? Okay.
Enables mobility bills.
not very well. Yeah.
Hi. So first off, thank you so much for your presentation. I think you've done a fair bit of research, and this takes, I mean, being the first panel on a discussion like this is hard enough already. So I'll try and keep this short. I thought you would, I mean, of course, we've been talking a lot about inclusivity, and you did a whole critique on MG Narega, and of course, the midday meal schemes. You took us through a lot of these schemes, and we focused on Aadhaar, how, linking those, of course, biometric data and digitalizing a lot of data in general is one of our core concepts in the present decade. And you sort of cannot deny that digitization is here to stay. You cannot sort of scale back down on that anymore. So if you are to digitize going further, how do you ensure that you bring in inclusivity? And we're talking intersectionally in that sense, both caste, class, gender. How do you, do you have policy recommendations for that, given that this is sort of a public policy, sort of an initiative? If you have recommendations on those, I would love to hear those. Thank you.
Recommendations are a bit tricky, not plural anyway. Just as the panelist also mentioned, that, okay, so you're talking about digitization in general. Do you know the penetration rate of smartphones in India? It's very low. It's very low. Even I don't remember the accurate number, but for women, it's really very low. And since public policy builds on data, you have that data with you. So I don't know how digitization would work in a country where something like COVID could strike and all the classrooms are shifted online and people do not own a smartphone or do not have internet connection or something. So even the data set that the gender mobile mobility index, or I don't know what it is called, something. So there, they even discuss how many women who own a smartphone actually know how to operate it. They cannot even, other than calling people, they cannot even do a Google search. Something that basic, that apparently we all know, right? So, I mean, I don't understand digitization in that context. I mean, it is quite, India is not there yet. I mean, a lot of people are, but not the entire population. So that is not inclusivity in any sense, even if you look at, and especially through an intersectional sense. So you would not find a lot of, so one of the Narega workers that we did met, she owned a smartphone. She knew how to use that NMMS app. She did not have an internet package. She did not have the money. Every time I cannot recharge this, right? So that is a big concern for a lot of people. She did buy the iPhone. She said, I took a loan to buy this smartphone because I needed the phone, because apps ke bina, they won't give you attendance for your work. So, I mean, it's a bigger social sort of a question rather than just a flamboyant idea that everything is digital and everything is on the internet, and I don't understand that.
And
Yeah.
adding to that, I don't think digitization, I mean, of course, digitization is here to stay. But I think it's a very far-fetched idea, and it's not going to reach this stage we often imagine it to be anytime soon. I mean, the government is promoting digitization, and University of Delhi's website can't handle it. When you have to submit online papers, it crashes. So there is that, and often IRCTC website crashes. And digitization comes, I mean, it's a very basic setup. If you consider the fact that the Prime Minister did, claim that every village has been, has received electricity, but when the recent president came to power, Draupadi Murmu, there were efforts to, make sure that electricity reached the village she's from. So clearly, these are all just high claims. And digitization, again, as we mentioned, as Sania mentioned, the gendered perspective, in many households, it's rather believed that, having an access to a smartphone for women is transgressing certain social norms because it opens you up to transgressing other norms. For example, there was a report released by Dalit Human Rights Defender Network in collaboration with National Council for Women Leaders. They released 2 reports, actually. One was on honor crimes, another was on violation of SC/ST acts. So the one on honor crimes, actually one of the appendices mentioned that this family, I will not go into the details of how they killed people, but basically they blamed themselves eventually for getting their daughter a phone because they thought beti ko phone dilaya isliye isne intercaste shaadi kari hai. So coming to digitization, I don't see, how we can actually penetrate as much as we expect it to, because again, smartphones are affordable, yes, but getting data, getting network, having electricity, and plus knowing how to use all these apps. At times, I get confused with the current websites they're coming up with a lot of scholarship websites. It's very confusing for me. I don't expect how people who are working entire day will be able to dedicate, a time out of their heavy schedules to learn how these apps work. So I think that's about it.
Thank you.
Thank you.
Hi guys. Thanks. We are running a little late, but we also don't have two papers, so I think that's fine. If at any point you think we are going too long with the questions, just let us know. We are doing it intentionally, obviously, because then we can have a larger discussion, right? The next paper is Social Security Provisions Available to Nurses and Auxiliary Nursing Midwives, ANMs, in Gwalior, Madhya Pradesh, by Shivangi Gupta, who's from TIS, Mumbai. I think you can present. Is this on? This is also.
Am I clearly audible to everyone? Yeah? Okay. Okay, thank you for being here, first of all. And yeah, so my paper is titled Social Security Provisions Available to Nurses and Auxiliary Nursing Midwives, ANMs in Gwalior, Madhya Pradesh. And before I begin with the paper, I just wanted to briefly acknowledge the institute, Tata Institute of Social Sciences, because this research was part of my dissertation submitted in partial requirement of the degree of Masters of Arts in Development Studies. And so I wanted to extend my heartfelt gratitude to all my professors there and to SPRF and OP Jindal for providing me this opportunity to present the insights today. And yeah, so this is a brief overview of the paper. I will first introduce the subject, which is women's participation in the labor force, the care economy, and then go through the research methodology, then present the key findings, and then finally conclude with the policy recommendations. So before I go to the question why social security provisions for nurses and ANMs are important, it's necessary to sort of review that question in terms of how it impacts women's participation in the labor force. So scholars like Frederick Engels, Amartya Sen, Nancy Folber, all of them have foregrounded the importance of women gaining agency of their earnings, and so gaining empowerment by earning as a step towards empowerment, right? So by expanding their capabilities and functionings. But just mere participation in the labor force is not the goal, because it is also important for them to be able to handle their money. Who is handling the money? Who is the money going to? How are they negotiating with the labor market? What kind of factors influence their participation in the labor market? All of those factors also come in the picture. And so the second aspect of this whole social security provisions for nurses and ANMs is the care economy. So the care economy spans paid and unpaid labor services that support caregiving in all forms, and it includes a wide variety of activities from teaching to domestic labor to healthcare services. And the interesting part here is that over 80% of healthcare workers in India are women, especially when it comes to nurses and ANMs. So there's a great Venn diagram that we are drawing, that if we are to look at women's participation in the labor force, which is declining for India and for a lot of other countries, so it is essential for us to look at healthcare workers and to look at care economy substantially, and to look at what factors are there that are either holding them back from participating in the labor force, or not providing them enough support, not keeping them afloat, and not providing them enough agency to expand their capabilities, even while they are participating in the labor force. So what is that gap? And yeah, so the last point was that the invisibilization of care work and the undervaluation of care work which we can take as unpaid care work. Here I will just be talking about unpaid care work. That the invisibilization and undervaluation of that work, since it's not counted as labor, often in even time use surveys or even in surveys, it's not counted as work. So that kind of bias also is transferred to the labor market, and when women participate in the labor market, they're easily sort of drawn towards these categorizations that, okay, you participate as domestic laborers, or so these are the avenues that are open to them. And so those biases also then produce precarity in terms of low wages, exploitative working conditions, etc. So that's why this is the whole context to the research. Now coming to the research methodology, so my objectives were to understand the working conditions of two categories of paid workers. Initially, I sort of began with, I also wanted to interview auxiliary nursing, Anganwadi helpers, Anganwadi workers, and also home-based care workers, etc. But it was not feasible for the study, so I reduced the sample size to nurses and ANMs. Then the second was to understand their human capital composition, to understand what kind of social security provisions do they have available to them, and to understand the burden of care work that they bear at home and how it impacts their participation in the labor force. The methodology incorporated both objective and open-ended or subjective questions. So both qualitative and quantitative questions were there in the research tool. And the location of the fieldwork was my hometown, Gwalior. And for the purpose of this research, convenience sampling was used. Initially, I intended snowball sampling to be implemented, but since there was, the field was such that the participants had very strict schedules, and it was just not possible for me to snowball the sample, so I had to convenience. And yeah, lastly, the personal interviews were conducted across several hospitals, civil dispensaries, Anganwadi centers, and maternity centers between 7th of July and 20th of July 2022. The limitations of this research are primarily the fact that it was based on convenience sampling, so we cannot generalize the results to a large population, but we can certainly draw some conclusions based on the experiences of these nurses and ANMs. And secondly, due to the paucity of time and the hectic schedules of the research participants, very few nurses from private sector could be interviewed. Initially, I wanted a comparison between private and the government sector, as well as nurses and ANMs, but yeah, so the private and government comparison could not be that robust because the sample size is not such. Lastly, for the crucial analysis of social security, I've drawn from the framework of ILO and the extensive framework that Guy Standing has sort of written about in his paper From People's Social Security Surveys to a Decent Work Index, where he's talking about 7 parameters of social security, which is labor market security, employment security, job security, work security, skill reproduction security, income security, and representation security. I have chosen employment security, work security, income security, representation security, skill reproduction security. Then social security is based on the ILO Convention 202, and income I've taken as a log, as a sort of comparative axis. So all of these indices are compared with income to sort of draw a comparison that does income impact the kind of social security provisions that are available to them. So yeah, that is the basic framework. So I can now begin with the key findings of the research, and before that I will just first go over the profile of research participants. So a total of 45 women were interviewed as part of the study, with 21 ANMs and 24 nurses. Approximately 26% of the participants work in organizations that employ less than 20 people. This is just an indicator to show that these organizations are well capable of, or they should be providing these social security provisions to all of their employees, especially as 62% of them are employed in organizations with more than 20 people, and 33% of them are working for exceptionally large organizations, which are, some of them were even working for 1,000 plus employees. So there's that. The second aspect is their age and their marital status. So over 60% of the participants are concentrated in the age bracket of 20 to 37 years. And if I note the overlap in the data on variables like age, marital status, and age at the time of marriage, the interesting finding that I got was that a lot of these women were recently married women in their late 20s. Now that will become important in the later part of the paper where we discuss the burden of care work. So it is precisely this age group and precisely these women who are under the social obligation of a lot of burden of care work that falls on them. Right. And right, so education and how long have they been working for? So this was also to gain, to sort of gauge if nurses and A&Ms are sort of aiming for different kind of qualifications, or there is a difference in what they are aspiring towards, and then eventually ending up as. So later in the qualitative part of the study, there was also the question if they intended to do these jobs, and there that division sort of came up more drastically, that a lot of A&Ms did not intend to do this job, while a lot of nurses wanted to, and that's why they pursued that kind of education. Whereas a lot of A&Ms just sort of found them ending up as A&Ms because of their because of other factors that we will discuss shortly. So yeah, so almost 49% of the participants had been part of the workforce for 5 to 15 years. This will also reflect on the kind of things they've had to, the kind of ways in which they have had to navigate participating in the labor force as women, because they've been part of the labor force for so long. And lastly, a profile of the households. So over 37% of the participants are from upper caste Hindu households, while over 62% of them belong to the other caste groups. Over 76% of the households have 3 to 5 earning members. But interestingly, 24% of the participants report that they were the only earning members in their household, and 20% of the households earn less than 20,000, and close to 1/3 earn between 40 to 60,000. The last part is about just precarity, so that we can draw a relative comparison and say that households earning more than 60,000 are relatively less vulnerable than the other sample. Okay, so now coming to the individual indices that I have calculated and then mapped them for nurses and A&Ms. So overall, there is a positive relationship between employment security and income. That is, the higher the income, one is more likely to be permanently employed and be stationed at one fixed place instead of having to work on the field. So these are two indicators that were taken to calculate this index. And this is all based on Guy Standing's framework only. And so there's a stark contrast between nurses and A&Ms, as 42% A&M score 0 on the index, while approximately 89% nurses achieve a score closer to 1, and only 9% A&Ms do so. Secondly, work security. There is overall a negative relationship, because work security was an index which sort of dealt with having to work long work hours or night shift. So A&Ms proved to be 62% of the participants score 0, but while 52% A&Ms face relative insecurity, only 25% nurses do so. So it's just that A&Ms are expected to work longer hours, and they're also out on the field. So there's that comparison. And then the income security. So this indicator accounted for not just income adequacy, but also income regularity. So are they able to save was an indicator that I took for income adequacy, and do they receive payments before like 90 days is the indicator for regularity. So while over 26% of the participants score 0 on the index, indicating relative insecurity, 40% of the participants achieve a score closer to 1. Again, 83% nurses are better secured as compared to 61% A&Ms. Also, just an interesting point here, that among all these indices, nobody scored a 1. Nobody scored a 1. So it just indicates that there's relative insecurity for everyone, but A&Ms are just more precarious than nurses are placed. So for representation security, again, there's an overall positive relationship. So if one is the higher the income, one is more likely to be a member of respective workers association or be aware of their entitlements as health workers. Here, the interesting point was organization type. So all the private employees that I interviewed, no, none of them were part of any labor unions. They hadn't even heard of them, and they hadn't even conceptualized that there could be such a sort of group of people where we could all get together, because maybe because the precarity and the informal setup of their employment is such that they have not thought of that avenue. But also an important point here was that a lot of A&Ms that I interviewed shared their experience of their respective labor unions working for them. And some of them raised points such as that they have been striking, so they strike every once in a while when their payment is held back, or when there is some kind of demands are not being met. But some of them have been working as contractual workers for over 7 years, and they continuously keep striking, but that sort of has become ritualized now, and it for the time being their demands are pacified, but then it's never, the regularity of employment is not defined. There is no specific period after which you are moved from contractual to a permanent employment. Then we come to skill reproduction security, which is do they have opportunities for further professional training and education to retain and gain skills in their field? While over 28% participants score 0 on the index, relative insecurity indicating, and 68% of the participants achieve a score closer to 1. So this is, again, this is, so there were 3 indicators that I considered for this. One was on-job training, which A&Ms receive for different kind of missions that are there. The other is in-job education that you can pursue. If you have a BSc, you can pursue an MSc, which is obviously a better professional training opportunity than on-job training. And then, so again, the results are that, so here the results are, that's why interesting that 80% A&Ms are better secured because they get on-job training more often than nurses do. And yeah, so observing the distribution of scores based on organization type, the bulk of the private employees scored 0. And lastly, the social security index. This was an interesting index to even calculate because it had a lot of social security provisions to consider. Okay. All right. That's me. Should I take 2 more steps back? Yeah. Sure. I'll stop if it comes back. So yeah, social security, because this was based on the ILO kind of social security, the Convention 202, and it included provisions like health insurance, pension, maternity leave, survival benefits, injury security benefits, house rent, and other allowances. And because the data, because there were so many indicators, I got a lot of variation in the scores. And but the interesting observation again here was that since the indicator comprises several indicators, the scores are more spread out as compared to other indices. 11% of participants score 0 on the index, and cumulatively 48% of the participants achieve a score less than 0.5, indicating relative insecurity. But largely the data was spread evenly for nurses and A&Ms for social security index in particular. However, we note that private employees face a higher degree of vulnerability as compared to government employees, only for the social security index I'm talking. Otherwise, yeah, the breakup has been as such that nurses are relatively more secure in terms of employment security, work security, income security, and as compared to A&Ms, whereas A&Ms are better secured in terms of representation security and skill reproduction security. So the next few sections are primarily based on the qualitative part of the study. So when I asked them about their working conditions and the challenges they had faced, over 55% of the participants usually worked 6 hour long shifts. Between nurses and A&Ms, more A&Ms work 8 hour long shifts, and the work of A&Ms is more extensive, exhaustive, and arduous as compared to that of nurses. And by far the most common concern they raised was the back-breaking workload. So even when they were talking about the kind of importance they associated with the work they did, because they realized that they are doctors on the field and they have the responsibility to gauge the health status of an entire community as opposed to an individual household or a few people in particular. Even while they have that sort of understanding and acknowledgement and perception, they realize that the amount of hard work they are expected to put in is not commensurate to the amount of remuneration they receive. So a lot of challenges that emerged can be sort of categorized under three headings, which is infrastructure, dealing with rude attenders and beneficiaries, and lastly grievance redressal and attitude of superiors. So infrastructure, both nurses and ANMs kept sort of repeating the fact that they don't have access to toilets and sanitation and like drinkable water. For nurses, this becomes emphasized or sort of aggravated for night shifts, because that is a time when they also do not have the provision easily available in close proximity. For ANMs, this is a challenge on field. For nurses also, there was the challenge that a lot of nurses this was not a challenge in the private hospitals, by the way. Only the government hospitals kept sort of repeating these points, that they didn't have changing rooms or any kind of nursing station for themselves. And they kept repeating the fact that how intruded they felt by the attenders who would sort of keep visiting, and there was no sort of security or privacy for them. For ANMs, of course, it's a job on the field. Most Anganwadis are located in really remote areas, and sometimes it's just a room with no other facility attached to it. So there's really it becomes really difficult for them to work for long hours without any kind of provision. The second is that dealing with people. For nurses, again, this is a fact that a lot of them kept talking about how aggressive attenders can become, and how lack of security in the building and within the hospital made it difficult for them to do their jobs on a daily basis. And for ANMs, there was more. So this had more of an institutional perspective for ANMs as well, in that not only they face hostility by people because they keep visiting them again and again for collecting surveys, but they also pointed out that it's the shortcoming of their supervisors who do not realize that they should be telling us that, okay, you collect all this information in one go, but instead they keep repeating that, no, this is missing, again, this is missing. And so it becomes a headache for them instead of the beneficiaries. And lastly, grievance redressal. That while majority of the respondents said that their superiors and co-workers are cooperative, they also reported that grievance redressal often depends upon the whims and fancies of people in positions of power. If they are sympathetic to the concerns raised, otherwise it remains contingent on what connections one can leverage to get their voices heard. Okay, so the next section is on social determinants of work. What basically motivated these women to take up these jobs? So approximately 86% of the participants like the work that they do, but 55% report that they did not intend to take up this job. So familial pressure, financial insecurity, lack of familial support, and or circumstances emerge as reasons for not being able to pursue their dreams. Several of them had to take up employment in order to make ends meet, and they remark how it did not matter if they enjoyed the job, since it's just a job and one has to pay the bills. While approximately 20% of the research participants spoke about how their work is characterized as a service to others and thus perceived well by relatives and friends. They also spoke about the kind of security of employment as a government employee elicited respectability. So it's not just that it's not just that their work is good and it's a service to others, but even so I'll just draw on two examples here. So nurses received a lot of social stigma for working night shifts, and a lot of them repeated these really long stories about how they would be on the receiving end of a lot of pejorative comments about how your work is such that you have to go out in the night. and it's just generally characterized as women of loose character do this work, and women whose husbands have left them, things like that. And they had to hear all of that. But the ANMs sort of have to hear things like, your job is meaningless, your job is menial, your job is you're sort of made to work like a donkey, but you're not paid enough for it. So there is that kind of division there. But both of them receive some kind of respectability just because it's a government job, and so there is that social sort of perception that is coming in. Yeah, so lastly, their life at home. So both nurses and ANMs follow a similar script of juggling household chores and care work with their jobs and barely find time for rest and leisure. And marital status was a significant indicator here because I sort of observed that single women had much more time to themselves and much more time for leisure than married women did. And both nurses and ANMs face societal and familial pressures for choosing to work outside, which greatly influences their likelihood of remaining in employment and sustaining their personal well-being. So this I would also like to substantiate with some amount of data. There was a comprehensive research on the size and distribution of the healthcare workers in India, and there was a great percentage of people who are trained in medical sort of healthcare, but they are choosing to not participate in the labor force, and the highest percentage of that sort of population was for the nurses or the midwives, and their highest quoted reason for not participating was the burden of care work. So there is that quantifiable research there. And when asked about the challenges they faced at home, 26% of the participants responded negatively, but others talked about the offhand comments they received to their clothes, the kind of rope-toke they had to navigate. And a lot of respondents actually remarked that such challenges were the norm in families, and they had to sort of figure out ways to go about it, and there's no two ways about it, that it's just so normal that you have to figure out ways to go about it. And yeah, lastly, there was also a time use survey aspect to the study, and for work, respondents on average spent 8 hours every day on their primary productive activity, but the highest maximum value for this variable was 11 hours. Household chores, on an average, women did 5.26 hours on household chores, childcare and elderly care. The maximum value for this indicator was 13 hours. And sleep, on average, the women are sleeping 6.6 hours. And the minimum value for this was 4.5 hours, which was actually for a number of people, not just a few. Leisure time was approximately 1.8 hours for personal leisure, and minimum value for this variable was 0.5. And consumption of media, approximately 1.8 hours for personal consumption of media, but the minimum value for this observation was 0.17 hours. And yeah, finally, to the conclusion of this study, the study reflects how nurses and ANMs face exhaustive work hours and relative insecurity when it comes to social security provisions, ANMs more so than nurses. And reflecting on the subjective responses of burden of care work, it becomes clear that it would be significantly difficult for women to sustain work if burden of unpaid care work is not shared at home. So while women's participation in the labor force is a step towards empowerment by expanding their capabilities and functionings, mere participation in the labor force does not guarantee that, and so it has to be substantiated by, it becomes imperative that policy measures ensure that provisioning of adequate social security measures in order to retain women in the labor force, and decent work is a step towards that. So it would ensure nurses and ANMs safe and healthy working conditions, which are crucial for their physical and mental well-being. And here, I would also like to substantiate this with ILO's recent report on care at work, which stresses how public investment in care services are critical for maximizing and sustaining the impacts of cash transfers, which do not have similar potential to generate quality jobs. So simple and just cash transfers cannot be the answer. We have to look at more structural and more institutional issues of providing quality jobs and providing social security to all sectors, and more so for the care sector if we are talking about women's participation in the labor force and wanting to sort of make it better. yeah, so that's it from my end. Thank you.
Hi, am I audible? Yeah.
Yes.
I just wanted to ask, so for the A&Ms, like, what were the other like alternatives to employment that like did they have? Like, was
I'm sorry, it's not perfectly audible.
is this better? Is this
Slightly.
Yeah. Okay, how about this? Yeah. Basically, I just wanted to ask, like, what were the other alternative sources of employment that the A&Ms could like
Could pursue.
could pursue? Yeah.
I wouldn't say many because a lot of them reported that they filled the exams out of necessity, that they wanted a job and they needed a job, and so this was one thing that sort of came. Because see, the difference is that while nurses have to pursue education before gaining employment, A&Ms get the promise of employment and then they are trained by the government. So there is that kind of division, right? So a lot of them actually didn't have any other uh, say avenues open and they just sort of applied, and so yeah.
And just one more thing. I think you might have covered it in the beginning, but what was like the caste composition?
Caste composition, right? So 37% are from upper caste Hindu households and 62 to 67% are from other caste groups. There is division between that, but that was more or less evenly spread, so that's why I didn't mention it otherwise.
And that contrasted with the private nurses would have been like a lot
For
more.
private and government, was there a difference? I'm not. See, the difference between private and government was a lot, right? So there's only 8 participants who are private. So I've not been focusing on the differences there because it's not a great sample size to compare with. Yeah.
Thank you for that, Shivangi. Just kind of building on to what Ankush, I think was it Ankush, was it Arvind mentioned. When you talk about on-job training for A&Ms, it also opens up 2 possibilities: A, of intra-sector mobility, but also the effect that on-job training might have on their job security. So how do you analyze the effects of on-the-job training on A, intra-sector mobility for A&Ms, and job security in the long run?
On-job training, yeah, right? Again, not very much. It was very disheartening to hear a lot of them say that there is no promotion in this job, that this is it, and that they won't get promoted. So there was already that kind of mindset. I don't know if they could pursue. Some of them, I suppose, some of them could pursue BSc after they've been an A&M for a while. But again, the lot of factors would come in that they would have to lose out on the kind of employment that they're getting, the wage income that they're getting right now, and if that would be feasible or not would depend on their financial circumstances. But yeah, otherwise there's not a lot of, like, the job itself does not provide a lot of intersectoral mobility or job security for that matter, because a lot of people are now being contractually employed and there is no clarity on when do you become a permanent employee. So
I wanted to ask 2 things. So one, because you talked about the marital status of the nurses and the ANCs, is there an uptick after getting married in terms of seeking employment, or the marital status does not affect that at all? And the other thing that I wanted to ask was, we also talked about the care work at home. So I remember you mentioned that a lot of these nurses just worked at night, but were there ones that operated during the day? And if they did, how did they manage the care work at home? Like, did they have to leave their job and go back home and then come back, give extra hours, or did they get like some sort of like a buffer period between that, or not at all?
wait, I didn't get the last part. You mean so when nurses are working during the day, how are they managing the work at home?
Yeah, because a lot of care work that happens
So,
at home? Yeah.
okay, so just to answer that first, lot of the night shifts in this job are integral to the job itself. So it's not like some nurses work day shifts and some work night shifts. They work both shifts, and it just keeps repeating at an interval. For the government employees, at least, some women did report that they choose not to work night shifts because they have young children and they can't. So there were those factors. But in all cases, when they were married and they had burden of care work at home, they were somehow just managing it, and they would, as by way of answering my questions as how do you manage this amount of work in this much time, they would just say that work never ends, 24 hours we are working, there's no rest for us. When we come here to work, there's at least some amount of rest because between patients we are free. But at home, there's no rest. At home, we are juggling childcare while cooking. So there's all of that. So there's somehow they are managing, but there are no demarcations. And the previous question, I don't think I'm like in a position to answer that because I didn't I didn't have that indicator in mind that are they pursuing jobs after they're getting married or not. Uh, there is a substantial amount of familial pressure that I observed from a lot of these women who were newly married and then who would have to sort of face their in-laws, who would raise objections on their clothes, on their mobility, and they had to sort of negotiate and just sort of stick to their battles, etc. But yeah, again, like I don't think I'll be able to answer that.
I have a couple of questions, but I think we need to break right now. So I'll just ask.
Yeah, fine, absolutely.
Guys, Ankit, do we have to break outside? Do we have to break? We don't have to break. Right? Yeah.
Okay.
Let's just do a 10-minute break. Cool, let's just go. Then we'll come back and wrap up.
Thank you.
And our topic today is analyzing Brazil's welfare scheme, Bolsa Familia, an attempt to break India's generational poverty. So Brazil shares many similarities with India, as both countries are diverse in terms of languages and cultures, share land border similarities, and are emerging economies. India faces issues same as Brazil in matter of reducing poverty, illiteracy, healthcare infrastructure, and child nutrition. And that's one of our primary reasons to consider this topic as our project. This paper is an attempt to analyze the Bolsa Familia program and draw a comparative analysis to understand how the program can be used as an inspiration to apply a similar model in India to eradicate poverty and considerably increase the health and education standards of the nation. So our presentation is divided into 7 parts. We would like to talk about welfare schemes in Brazil, their background, and the program Bolsa Familia itself, the impact of this program, the background of welfare schemes in India, replication of Bolsa Familia in India, policy suggestions from our side, and conclusion. So to start with, background of welfare schemes in Brazil. As we know, Brazil is the 7th populous country, which is often considered as an emerging economy. This South American nation has a painful colonial past, just like India, and has historically struggled with problems like structural inequality and poverty. For many years, people died out of starvation and hunger. And this is one of the major problems for Brazilian government to tackle with. So according to the estimates of the World Bank, between 1995 and 2003, there were over 20 million Brazilians living below the poverty line, earning the bare minimum of only $1.90 US per day. Brazilians were having difficulty in fulfilling their immediate needs, as basic as ensuring they have a place to live, food to eat, and employment. Thinking about the future and investing in education and primary healthcare, it was a distinct idea. And this can be resonated in Indian rural areas and also parts of urban India. Previous Brazilian governments have failed to address this issue because the social safety nets fail to protect the low-income households. Although the government has initiated conditional cash transfer programs, they were very fragmented in nature, which means they were different from municipality to municipality, so they failed to address the problem. But the things started to change when Bolsa Familia welfare scheme was introduced by then President Lula Silva. So to talk about this program, Bolsa Familia, it was introduced by the President Silva in the year 2003. It was a nationwide CCT because it was not fragmented in nature anymore. The program was formulated by combining the existing programs like Bolsa Escola and the Child Labor Eradication Program and 3 other programs. And the program is not fragmented in nature anymore because it has a proper structure. The earlier programs have failed to protect larger informal labor market as well as low-income households in the country. But Bolsa Familia program changed the scenario greatly. This program is not fragmented in nature, unlike the previous policies, but instead it is now primarily managed by the local administration under the framework of the federal structure. The World Bank provided a loan to the Brazilian government in managing the Bolsa Familia program. And the commendable aspect of this program is that the country has used only 0.5% of its GDP to implement this program. And one of the main objectives of this program, which is very important, is to overcome the vicious cycle of the poverty in families and eliminate Brazil's historical structural inequality and poverty. So the main structure of the program is that it provides direct cash transfers of an average of around $35 US to poor families who have children, and it reaches around 13 million low-income families. This program operates in 3 dimensions, namely there is a direct cash transfer, and there is a strengthening exercise of basic social rights, and there is promotion of opportunities for the development of the families. The families receive cash only if they fulfill certain responsibilities, and that's the reason why this cash transfer program is conditional. And these conditions are important to break the generational poverty of the Brazil, and something that we have to learn from them. The program initially covered only 6 to 15 years age children, but later in the year 2008, it has expanded to the children aged between 16 to 17 as well. And the families receive cash only if they ensure to fulfill certain responsibilities like sending their children to school regularly and ensuring their health is proper, like sending them to health checkups regularly and ensuring that they're seeing doctors on and off. And the most important part of this program is that this program is generated or is differentiated by the age, not by the gender. Girls, boys, everyone, regardless of gender, are given the importance. But only older children aged 16 to 17 under this program receive more cash transfers because the need is also more. You need more nutrition and people are actually going to school, so you need more supplies. And the conditional transfers for the younger children, that is aged between 6 to 15, is a little smaller. And it is one of the best targeted programs in the world. And World Bank actually has written in one of its articles that this program reaches to those who really need it. Significant studies done by prominent institutions prove that around 94% of the funds reach 40% of the poor population, and most of the money is used to buy food, school supplies, and clothes for children. This program has sparked a massive success, and many adaptations of this program were followed. Countries like Indonesia, Chile, Mexico, Turkey, South Africa, and even in the so-called developed countries like the United States, New York City has adopted a similar policy. Now we'll talk about the impact of this program.
So, Bolsa Familia fared out to be one of the most successful social programs in the world. It lifted millions of people out of poverty and reduced income inequality in the country. Brazil was the second country in terms of inequality of income before Bolsa Familia had been implemented. Structural inequality in surrounding big cities such as Sao Paulo and Rio de Janeiro was very high before Bolsa Familia was introduced. However, after the implementation of the program, a great positive impact had been witnessed. I would like to talk about the income inequality and how that was impacted. The program contributed to reducing income equality, accounting for 12 to 21% of a sharp decline. Bolsa Familia was the second most important income source after labor earnings. The positive impact on gender inclusion and reduced rate of child labor was also witnessed. Since children were regularly required to attend schools, poor families did not force them into labor. Poverty and hunger was also drastically impacted. Before introducing the program, Brazil recorded very little change in levels of poverty. World Bank's report states that in 2009, poverty and extreme poverty came down 1.9 and 1.6 percentage points respectively. These numbers represented 13% of poverty and 32% of extreme poverty that year. As can be seen in this graph, the difference between poverty and extreme poverty in 1990 and then the same difference in 2009 drastically has reduced. The program had a significant impact in food availability as well. Consumption of fresh and nutritious food increased among poor families. There was also a diversity in consumption. The beneficiaries' households had 6% higher food expenditure and 9.4% higher total energy availability. It was found that a 7.3% higher expenditure on minimally processed foods and 10.4% higher expenditure on culinary ingredients was found amongst the families that were being benefited from this program. Health and education standards also increased after Bolsa Familia had been implemented. World Bank report states that the chances of a 15-year-old girl being in school increased by 21%. Increased regularity in vaccinations as compared to those who did not receive these funds was also seen. Better health standards, stronger immunity amongst children born in poor income families was how Bolsa Familia impacted Brazil. The students were showing up to school and they were performing better due to regularity, which also reflected on their grades. There was a study that was carried out and it showed that there's evidence that PBF has a significant and assertive impact, mainly on educational indicators directly linked to the conditionality of the Bolsa Familia program, such as school attendance and consequently on school dropout rates. The program required families to keep their children in school, and therefore they were more likely to seek medical care and send their children to school due to the benefits. A survey carried out in 2010 by National Institute of Health suggests that there were positive spillover effects on older siblings, aged 7 to 17, who no longer required meeting the health conditionalities. Bolsa Familia increased their odds for growth monitoring and checkups and improved their psychosocial health. An important factor contributing to the success of Bolsa Familia was its efficiency and its effectiveness. The program was well targeted, and the cash transfers were delivered directly to the families. It also helped to stimulate economic growth in Brazil. The cash transfers provided by the program were usually spent on food, housing, and other basic needs, which created a demand for goods and services in the local economy. This further helped to boost economic activity in poor communities and also create jobs in sectors such as agriculture and retail. Now that we have understood the impacts of Bolsa Familia, I would like to throw some light upon existing welfare schemes in India. India's welfare schemes have been implemented with the aim of reducing poverty, promoting education, and improving health outcomes. These schemes have played a crucial role in promoting gender equality and reducing the gender gap in India. For example, incentivizing families to invest in their girl child's education has led to increased enrollment and retention rates amongst girls. Other schemes which provide financial support to pregnant and lactating women enable them to take care of their health and nutritional needs. This promotes gender equality and maternal health. Some direct benefit transfer schemes we have covered in this paper, like Pradhan Mantri Jan Dhan Yojana. This scheme aims to provide financial inclusion to all households by opening bank accounts and providing them with debit cards. An overdraft facility of up to Rs 10,000 is also eligible to the account holders. There's another which is Pradhan Mantri Jan Arogya Yojana, also known as Ayushman Bharat. It was launched in 2018, and this scheme aims to provide health insurance coverage to vulnerable families in India. The scheme has a coverage of up to Rs 5 lakh per family per year and covers over 10 crore families. This scheme has not only improved access to healthcare for poor, but it has also helped in reducing out-of-pocket health expenditures, which happen to be a major cause of poverty in India. We have Pradhan Mantri Garib Kalyan Yojana. The scheme provided cash transfers to eligible households along with other benefits such as food assistance and support for agriculture and rural development. In 2020, during the pandemic, several changes were made to the scheme in wake of the pandemic. The scheme provided free food grains to vulnerable households, particularly those in rural areas. Direct cash transfers and food security played a crucial role in the lives of lower income households during that time. Women account holders and farmers were provided massive benefits. Janani Suraksha Yojana is another program, which is a maternity benefit scheme that was launched in 2005. It's one of the largest CCT programs in India. This scheme aims to promote institutional deliveries among pregnant women by providing financial assistance for maternal and child health services. The proportion of institutional deliveries in India increased from 47% in 2007 to 83% in 2015, largely due to the implementation of JSY. By providing financial assistance for institutional deliveries, the scheme encouraged women to seek medical care during childbirth, promoting their health and well-being. The scheme also contributed to improving gender equality by empowering women with greater control over their reproductive health decisions. Overall, CCT schemes in India have a considerable impact on poverty reduction, education, health, and income inequality reduction. Schemes have also been implemented on the state level like Chiranjeevi Yojana in Gujarat, Saubhagyavati scheme in UP, Janani Sayogi Yojana in Madhya Pradesh, etc. While challenges remain in terms of implementation and targeting of CCT schemes, they are an important tool in promoting social welfare in India.
So now, after discussing about the backgrounds of welfare schemes of both Brazil and India, now the question arises, can we replicate this scheme Bolsa Familia in India? So as of August, there are around 384 welfare schemes from 52 ministries working their way to people through the direct benefit transfer system of India, just like how Ashra has explained it before. The structure allowed the government to invest in existing social schemes, but one of the challenge that is faced by the Indian government is the unifying the entire welfare scheme system into a one particular plan in order to make it reachable to people more easily or make it accessible. But so the unifying the massive package of cash transfers and benefits into a consolidated welfare system is inevitably a long-term task that is there in front of India. There are also other certain challenges for India. For example, this scheme in Brazil, it targets mostly its urban population because only 14.4% of its population resides in rural areas. But whereas in India, over around 70% of its population lives in rural areas. Thus, implementation of such a program, which is framed to suit the urban population or the urban lower population in India, can be debatable. Secondly, the success of this program is majorly due to the database that has identified the beneficiaries and the potential beneficiaries. But whereas in India, as the first panelists have also discussed, the Aadhaar database is not at that point yet. It is voluntary and not mandatory. I think that is also a factor that we have to consider. But at the same time, Aadhaar is still in its initial stages, and due to lack of an accurate database, identifying beneficiaries would be a very difficult task. Thirdly, this scheme uses a specific poverty line for this scheme itself. But in India, we use a universal poverty line to all the schemes. So that can be a difficult task as well. And other than that, in India, factors like caste system, corruption, lack of transparency, poor health and educational infrastructure, etc., add a lot to the challenges in replicating this program directly in India. So what India needs is a Bolsa Familia program with an Indian touch. It needs a Bolsa Familia program of its own. So we have come up with 2 policy suggestions.
Conditional cash transfers have proven to be the most effective ways to reduce poverty and inequality in developing countries. Bolsa Familia is a wonderful example of that. We already have the midday meal program that takes care of the nutrition of children. After our research and understanding of Bolsa Familia, we came up with 2 policy suggestions. So firstly, India should make the income transfers conditional under Pradhan Mantri Garib Kalyan Yojana. The families should receive cash only if they fulfill responsibilities like ensuring that their children are attending the school regularly, provide nutrition and health care. The program can cover children aged 6 to 16 years, and there should be no gender discrimination. To implement such programs, India should also focus on developing its health and educational infrastructure by building more schools and hospitals, ensuring adequate amount of supplies in these institutions, efficient training and recruitment of teachers and doctors, availability of free education and primary health care, and usage of technology for the betterment of both the institutions.
And the second policy suggestion that we have come up is a scheme should be formulated on the lines of both Bolsa Familia and Manrega. So as we all know, Manrega focuses on the rural employment, but instead of just focusing on a rural employment, a proper scheme should be formulated which focuses on both rural employment and incorporating the financial incentive packages just like in Bolsa Familia model. These recommendations may prove to be a pathway for the rural poor in India, not just in terms of short-term poverty reduction, but hopefully in long-term run of India in order to eradicate its poverty and reduce its inequality. So concluding our project, India can take notes from the Bolsa Familia and formulate a scheme that suits its population. Although there is no concurrent evidence on how much cash transfer programs help in poverty alleviation, significant studies and researchers conducted by international institutions like World Bank indicate that these programs do help in poverty alleviation and decrease inequality. Adopting such a program and its proper implementation can be India's first step towards breaking its curse of generational poverty. Thank you.
Yeah, thank you. How much like the cash transfer, right? Like what is the proposed amount for that kind of cash transfer?
So the cash transfers are based on how many children do you have in the household, but at the same time, as if discussed it before, the poor families who have children receive an average of $35 per month as direct cash transfers. Other than the benefits of sending your children to school, like the education is free. At the same time, the primary healthcare is also free, and the nutrition is available in the educational institutions. So, in order to look after the immediate needs, like of that month, of that family, $35 is being provided.
So like enough to attribute for like nutritional requirements and all.
The nutritional requirements are the separate part. So it is given in the schools itself. It's not under this $35. So the health, education, and the nutrition is taken care of separately. And $35 is given as the direct cash transfers
To the
families,
families.
not to the children.
And it's on the families how they spend it
Yeah.
to come out of their poverty.
Like specifically for BPL families, right?
Yeah.
Yes.
When you were highlighting the challenges of sort of replicating Bolsa Familia in India, one of the challenges that you mentioned was it targets the urban, the
yeah.
population demographics, right?
Yeah.
India is mostly rural, has rural population, but Brazil has urban population. But other than that, I think the one other difference that I could see between the two countries is the society is very hierarchical. In fact, I don't think any other country will find so much hierarchy, social hierarchy, as much as you find in India. So, in talking about when you're saying for CCTs to function properly, you also need like a lot of infrastructure. But the lack of infrastructure is not the only thing that stops people from going, accessing education or healthcare for that matter. A lot of it also depends on social factors in a country like India, which might not, work for Brazil or is different for Brazil. So, keeping that in mind, do you think the CCTs are the one of the most feasible or practical solutions when it comes to taking that diversity into account?
Yeah. So as we've discussed before and even mentioned in our paper, so India is a very complex country. We are of our own. So factors like caste system and the hierarchy, the gender discrimination do play a role here. And rightly you've mentioned that this is even more hierarchical when it comes to the rural India than the urban. It's still there here, but still it's more significant there. So coming to the question, CCTs might not be the only answer, but it can definitely act as an anti-poverty, element or a tool. It is not the only answer, that we do agree. But considering the fact that India has so many welfare schemes, a welfare scheme can be formulated, as we've mentioned, on the lines of Manrega, which is giving an employment. But at the same time, you can also add the elements of Bolsa Familia, which is giving you financial incentive packages. I think that would answer the question.
Yeah, thank you for the presentation, guys. I have two questions. One is, how do you plan on tracking CCTs in a country like India, wherein data privacy and lack of infrastructure are two major concerns? And secondly, since you mentioned
Can you
that...
repeat the question? Your voice is...
Sorry?
Can you repeat the question?
Yeah, what mechanisms would you use to track CCTs in a country like India, where data privacy and lack of infrastructure are two major issues? And my second question is, since you mentioned that Bolsa Familia is gender blind, how do you kind of navigate through gender disparities and, again, budget allocations required for different genders inherently because of their different needs, especially when it comes to healthcare? So just being a little more specific, when, say, a menstruator hits puberty, they are expected to spend more money just to fulfill their sanitary needs, right? Which also means that the family itself will have to spend more. A lot of time they're not willing to spend it out of their own pockets, which again does two things. It A, hampers healthcare and their access to healthcare, and B, it also hampers their access to education because they stop going to schools if they don't have, say, just sanitary napkins to manage their menstruation, or say clean toilets and water at school to manage their menstruation. So how do you figure out that problem as well?
Yeah. So I think these are all the structural challenges that as a country we face, like when we try to implement a scheme like this. So the first question is, I think,
How to track the...
yeah. So although our Aadhaar database is not that perfect, but come to think of it, that's the only last resort kind of we do have. So our government kind of have to work in order to make sure that everyone is enrolled in Aadhaar. One of the important thing here is Aadhaar is not a compulsory thing. It's like if you want to go, you get registered yourself in the Aadhaar. Maybe we can change that. And also there are other important factors to consider here. There are privacy issues and also there are privacy violation issues here. But I think we have to consider all the facts. But at the same time, in order to implement a welfare scheme, we do need data. We require data of people. So maybe we should make Aadhaar database more accessible to people. At the same time, it should be mandatory at a certain point in time where people can come registered so that they get their beneficiary schemes. And coming to the second question, so this scheme doesn't discriminate on basis of gender. It's like, okay, girls and boys do not have any difference here. It's only on the basis of age, how much money as a family you get. So I think the Brazilian government has did an ample amount of job in order to, restructure the entire schools and education, especially in the time between 2003 and 2015 when President Silva was there. Then there was construction, there was infrastructure development of both schools and hospitals, and that's something we have to do here because we have seen in COVID how our healthcare infrastructure is very fragile. And we also know about the condition of our government schools. We do not have, as rightfully pointed out, we do not have sanitary napkins, and we also, and unfortunately, sanitary napkins in this country are the expensive things. It's kind of a privilege to buy a sanitary napkins. That's an unfortunate thing. I think that's something that we have to change in order to implement this scheme more freely and smoothly.
Oh, okay. Just one last question. If we are doing such an intensive overhaul of the Bolsa Familia scheme for it to be even remotely implementable in India, I mean, does that not cast not just aspersion but a big question on its suitability to the Indian context itself? Because what you're proposing at the end of it is an entire overhaul and a new scheme in place.
Can you repeat the question? Because the volume is...
Okay, so basically what you're suggesting is an entire overhaul of the Bolsa Familia scheme for the Indian context. So does that not cast huge aspersions on the suitability of the scheme itself in India?
It wouldn't be a complete overhaul. So even with Bolsa Familia, they had cash transfer programs earlier that they had implemented. But what they ultimately did was that they together implemented all these programs, like they made it into one, and then they implemented Bolsa Familia. In India too, we have the kind of welfare schemes that we have mentioned in our paper. So that is how we sort of take them and make a Bolsa Familia that sort of suits India, and not completely, it shouldn't like be an overhaul, but an inclusion of these programs and make it more better in terms of implementation, coming from the center towards the states.
Adding on to it, it's not like we do not have the entire infrastructure at all, because after independence, we have seen like the welfare schemes that are implemented in this country is massive. Like with that population, implementing has a lot of challenges, but still somehow at times we did manage. So it's not like we do not have the proper policy or implementation, but proper policy, but I think there are infrastructural challenges that we have to tackle, like construction of hospitals and schools, and also the recruitment of teachers and doctors and their training. And I think that's when this program will suit us. It's not entirely alien to us. It's something that we've been practicing, but well, small touches here and there. Mainly the conditional part. Maybe some things we have to add. Maybe we should tell our population that you should send your children to school. That's when you get the cash transfer.
Perfect. Okay, thank you for that. I think we can move on to our last presentation by Arvind.
poverty.support. Do you have pen drive? All right. Good afternoon, respected panelists, organizers, and all those gathered here today. My name is Arvind, and today I'll be discussing the Indira Gandhi Old Age Pension Scheme, or the IGNOAPS for short. It's a bit of a mouthful, so I might just stick to saying pension scheme. Basically, in this paper, I've taken a look at the functioning, status, and significance of the scheme regarding who it benefits and how. I've evaluated the scheme based on some select criteria and critiqued some of the major flaws in the implementation and theoretical base of the scheme itself. I prepared a few suggestions as to how the scheme can be improved, and hope that this presentation will instill some interest in elderly pension schemes in all of you. So this is more of a qualitative discussion. This is not focusing specifically on how it relates to like budget constraints specifically, but I will discuss that in passing. So without further ado, let's begin. So the scheme was established alongside the National Family Benefits Scheme and the National Maternity Benefits Scheme in 1995 as part of the National Social Assistance Policy, or the NSAP. It was established in compliance with Article 41 of the Indian Constitution, which essentially directs the state to provide assistance to its citizens in the case of unemployment, old age, disability, and other cases of undeserved want. The scheme has undergone multiple changes in composition, having begun as a centrally sponsored scheme to being shifted onto state plans, and then once again becoming a central scheme under the purview of the Ministry of Rural Development in 2014. The original criteria under the 1995 guidelines outlined eligible beneficiaries as those who are destitute and above 65 years of age. So basically each state had their own criteria for deciding destitution. And so each state would decide who is destitute, what qualifies as destitute, and so forth.
However, in 2007, this was expanded to include those with BPL status. So if you had, like, along with people who the state identified as destitute, anyone who in possession of a BPL card was eligible for the scheme. The amount disbursed in the original guidelines in 1995 entitled participants to receive 75 rupees a month as part of their pension plan. And it has been revised to 200 rupees a month for participants between 60 and 79 years of age, and rupees 500 for those aged 80 and above. Just to note, this amount has not been revised since 2006. Truly a wonderful time. So by looking at other national pension schemes, I'm specifically looking at national pension schemes because there's too much inconsistency between other states and their relevant elder age pension schemes. So we can understand the significance of the IG and OAPS through looking at these other schemes. For example, if we look at the Atal Pension Yojana, established in 2015, it was aimed specifically at non-tax-paying informal sector workers. It involved enrollment plans that entitled beneficiaries to receive between 1,000 rupees and 5,000 rupees post-retirement. Then we have the national pension system, the national pension scheme, which is more popular among formal sector workers and government employees, which basically takes a fraction of your monthly salary, which is usually matched by your employer as well. And post-retirement, it offers beneficiaries a lump sum amount as well as an annuity. So even though both of these schemes can, on first glance, provide much greater support than 200 rupees a month, they have their own issues in the sense that they are contributory schemes, right? So the individual would have to provide some sort of regular payment in order to finance their future. In this sense, the old age pension scheme by the state is a non-contributionary pension scheme, purely one-sided. For those in poverty with little to no means of income, contributory pension schemes are nowhere near their consideration. When you have low savings and irregular incomes, unconditional cash transfers provided via social pension schemes like this are essential to ensure some minimal income security. Social pension schemes should be seen less as a supplement to household income, but for those in retirement age, it should be seen as a method to ease and support the living costs of those at retirement age. So a few issues that I've seen when I was going through the data, when I was preparing for this, there isn't a very sort of coherent sort of availability of data on the Indira Gandhi old age pension scheme. It's given as a part of the social assistance policy. So whatever factor of the budget that it is not, it's kind of muted and given as part of that lump sum. But the NSAP itself is already 0.05%, no, 0.5% of the total budget that of public government expenditure on social assistance programs. So it's a very small amount regardless. Due to the lack of coherent data as well, there is a lack of research on the topic. There are a few specific papers, but there aren't many in-depth sort of inquiries into the subject. And one big issue is also when they discuss issues of targeting success, how many people they cover, there is a general underestimation of the below poverty line population, or the population who would be sort of eligible for this scheme. As of, I think in 2005, there was a study that stated that roughly 50% of below poverty line families did not have a below poverty line status. They were essentially invisible in terms of social assistance. So I look at the effects of the scheme. So first I'm looking at the effects on welfare, right? So how effective is the scheme in promoting welfare for these elderly, poor people? Well, unconditional cash transfers have already been solidly covered as far as their effects on welfare are they are very good at improving people's quality of life. multiple instances of international research on unconditional cash transfers highlight the improvements to consumption and changes to labor supply that arise with these improvements to disposable income. So an example is the Adultos Mayores program in Mexico, which essentially offers a pension to people above the age of 70 in rural areas. And essentially it improved household consumption by over 20%, and it reduced labor hours in like rural households which were credited with the pension. And as well, there was a measured improvement in the overall mental health of people who were receiving the pension. Similarly, like there's another example in South Africa where old age pensions not only managed to improve sort of consumption, but they also managed to encourage like household labor market participation, as this increased interdependence between like family, right, in extended families, encouraged like mothers to work longer hours as they were more comfortable leaving their children in the care of like their in the care of their grandmothers and such. So if we look at the Indian context, this theme continues to hold true, with research indicating increases across most welfare indicators. Households receiving the old age pensions spend roughly 6% more on food consumption, 9% more on non-food consumption, which is mainly essentials like medicine and such, and it reduced household labor hours by 10%. It's not clear whether this is why the reduce in household labor hours was a factor of like the elderly people reducing their labor, or whether it was just participants in the household reducing their labor. But yeah. However, one thing that was documented or was not documented was sort of the reducing effect of poverty. While it helped to alleviate poverty to some extent, it did not reduce the level of poverty. It did not bring families out of poverty, right? I mean, this is likely because of the minuscule amount that's been disbursed. Similarly, other studies found expected effects for lower income households to be minimal, if not statistically insignificant. This could point to a failure of disbursement or identification for poorer households. Again, this could be due to a lack of awareness of the program or due to difficulties faced in registration. A quote by Jean Dreze in his cover of the pension scheme summarizes the perception of the pension by recipients. Modest as they are, the pensions tend to be highly valued by the recipients. Most of them live in penury, and the monthly pension is a chance to enjoy small comforts, relieving their pain with some medicine, getting their sandals repaired, or simply avoiding hunger. So one of the more encouraging aspects of the scheme is that the transfers appear to be going to the people intended to receive them. There was a survey called the Public Evaluation of Entitlement Program, which the PEEP survey, which found that from 10 randomly selected pension lists from across the country, 98% of the intended beneficiaries were alive and receiving the pension, which is a pretty good sign as far as like targeting goes. There are minimal leakages, but these are mostly in the form of official employees, like post station employees, taking a cut of the disbursement in order to disperse it to the beneficiaries. However, this success in targeting is shadowed by a large gap in coverage. Targeting success is generally defined by how well it minimizes exclusion errors and inclusion errors. So exclusion errors refer to the number of exclusion errors refer to the number of potential beneficiaries who, despite maintaining eligibility for the program, were not included, while inclusion errors refer to the inclusion of beneficiaries for the program who would not necessarily fall under the eligible group. Like in this context, it would be the inclusion of non-poor in the poverty alleviation scheme, or say poor, not old people, right? Say people at the age of 30 or 40 who were receiving the pension. A certain study examining IHDS data estimated an exclusion rate of 74% in 2011-12, and an inclusion error rate of 41%, implying that not only are a large number of poor elderly beneficiaries not availing the program, a significant portion of the realized beneficiaries were not specifically in the target population for the program. Again, this is also comes with its own issues, as there is no specific way to identify people who were eligible for the program. Usually studies use proxies such as general like possession of assets or education levels, and they basically contrast that with their poverty status. So this could either stem from an oversight either in the identification or implementation of the scheme. However, it's difficult to estimate whether this is a problem at the national or state level of administration. Weaker targeting is also a byproduct of movement towards universalization by expanding the eligibility criteria, such as expanding it towards BPL people rather than just having it at the state level of identification. The chance of exclusion of potential beneficiaries reduces, but the targeting efficiency would fall given the same level of administrative capacity. So while the pension amount provided isn't particularly impressive, inconsistency in the disbursement of payment betrays any sort of income security for the pensioners. In states, according to the PEEP survey, in states like Chhattisgarh, Tamil Nadu, and Rajasthan, pensions were generally deposited monthly but lacked a fixed schedule. While in states like Bihar, Himachal, and Uttar Pradesh, payments every few months happened according to no fixed schedule, though the amount was still dispensed in full. Pensioners also reported receiving no information of whether the pension had been deposited. Hence, pensioners would only make a trip every 3 to 4 months to the bank due to the high transaction costs of withdrawal. You know, given like when you have such a low level of income, the cost of just going to the bank itself is such a high opportunity cost for people who are who lack any sort of like financial security. Right, you miss out on the chance of one day's worth of salary, or just a certain meal, for example. In all the surveyed states, only Odisha was reported to regularly disperse the pension each month according to a fixed schedule. So, based on all of these issues and some other reports, I've also come up with some recommendations. So the effect of the scheme for pensioners can be seen to have vast effects on individual welfare, despite whatever existing drawbacks exist. Hence, any suitable revisions to the system can be estimated to have dramatic improvements on individual and household welfare and agency. So some of the suggestions I've come up with are a revision in the pension amount to at least 500 rupees, regardless of age, and indexing it to the rate of inflation. So even though, if we look at the Rangarajan committee, who estimated the poverty line at say roughly 950 rupees in 2014 for rural households. So some people have basically said that we should scale it so that we should scale the pension amount so that it at least fulfills that basic level of like that basic level of like poverty alleviation, essentially. But again, it's given that there's already so much sort of bureaucratic inertia, starting at a lower level, say 500 rupees, even though it wouldn't technically reduce poverty rates, it would significantly improve the alleviation of poverty for multiple households. And indexing it to the rate of inflation would also improve, would also make sure that poor people aren't left behind in the lurch. The idea that 200 rupees would have been a suitable amount in 2006, given the rate of inflation so far, 200 rupees should have been scaled to at least around 450, 500 rupees, given the current, for 2023, for example. So even though multiple states tend to match or even outdo the center's contribution for the pension scheme, the amount received by beneficiaries still leaves them way below the poverty line in the absence of other sources of income. Inflation has reduced the real value of what was already a low amount, leaving beneficiaries with minimal purchasing power. details for this amendment can adopt similar criteria to the DNS allowance provision, which is provided to central government employees, where their salaries are also like indexed to inflation to a certain extent. The second suggestion I've had is a simplification of the application process. Despite the required documents necessary to provide eligibility not being particularly complicated, usually it's just proof of it's your BPL state, like a BPL card, proof of residence, such and such. It's not a lot of documents. The process itself to attain these documents is pretty complicated. Studies reported that roughly a quarter of beneficiaries reported the attainment of the necessary documents itself being the most difficult part of the application process. The transaction cost of attaining these different documents remains significantly higher for people below the poverty line, for whom one day can make a significant difference in their attained livelihood. This can exacerbate the level of exclusion errors in the program. There are also different standards for verification of documents across different states, such as different criteria for provision of proof of residence. In Haryana, I think you will need to provide proof of residence for 1 year, but in Delhi, you would need to provide proof of residence for 5 years, which is incredibly more complex than providing for your proof of residence for a single year. Beneficiaries also had difficulty in understanding the eligibility requirements, and time required for sanction of the necessary documents and the incurred cost of finances and time all combine to make the application process a more arduous ordeal than it has already been intended to be. Similarly, something that could work to streamline this part of the process would be an emphasis on proactivity on the side of the state through processes like identification and enrollment camps. These would encourage more to sign up for the program and account for a reduction in the level of exclusion errors. To reduce the bureaucratic load on beneficiaries, there is a recommendation to scrap the requirements to produce documentation almost completely, and instead suggest using state databases or registries to identify eligibility. This would improve the movement towards a universal pension scheme as well, while significantly reducing exclusion errors. The preparation of a pension target list has also been suggested in a task force that had been organized by the Ministry of Rural Development in 2014. Whereby potentially eligible beneficiaries would be identified via state databases or from census data, such as the socioeconomic and caste census. Verification exercises can also be held regularly to control for potential inclusion errors in the initial period, and this would mitigate the issues of inclusion errors for families on the BPL registry. So families that are on the BPL registry, while not specifically being below poverty line, holding these sort of verification processes would help reduce the inclusion errors and make sure that the funds dispersed to them end up going to more deserving families. For many beneficiaries, there also exists an issue in delay of disbursement of funds. And again, while this may not seem as serious as the other issues, given that the execution of the program seems to profess a minimal leakage, as I mentioned before, it betrays any assumption of income security for the beneficiary. Hence, some binding provision to ensure on-time delivery of funds would be necessary. Disbursement of these funds should be made a high priority by the relevant authority to ensure that money is released by the desired deadline. Given the emphasis on direct bank transfers in recent government schemes, during the enrollment camps for the scheme, some provision to increase awareness or desirability of bank accounts for the eligible people would also prove useful and reduce emphasis on cash transfers, which could also reduce leakages. So basically, to conclude, though the program is well-meaning, the scheme lacks a cohesive targeting strategy and is in need of an urgent revision of the pension amount to account for growing inflation and reductions in purchasing power. Given that India's elderly population could soon account for almost 20% of the population by, say, 2050, it is important that these revisions are made sooner rather than later. The NSAP alone is a paltry amount of the total public expenditure on GDP, and so we need to hence improve public spending to ensure that people are able to live have a better quality and dignity of life. The availability of data also needs to be improved, and as well as the depth of investigations into such data, in order to improve our understandings of the effect and how to improve such programs. Yeah, that's it. Thank you. Yeah. Sorry? Um, so I think specifically there was just a general sort of like emphasis in the government. Like when I mentioned earlier that these like disbursement of funds should be made a high priority sort of thing, right? It was in Odisha, like it was made a high priority sort of scheme. It was the disbursement of those funds was made to be very important. And yeah, I think there's also just, I'm not particularly sure, but I can find out. No, hmm. Hmm. As far as I understand, it wasn't so much of a population-related thing, so much as a bureaucratic effort. I think there's a note I made somewhere. I, one thing that they did implement was a fixed date for the implementation, for like the disbursement of these funds, right? So that is one way to also improve like the priority level of the thing. A lot of other states don't have a specific fixed date for this sort of disbursement. So that sort of enabled them to, and since the allocations to each state by the Ministry of Rural Development is made annually, right? So you get those funds essentially in one shot. So making that sort of monthly disbursement at that fixed date, like you have the funds, so the bureaucratic process were already sort of in place, exactly. Yeah. Thank you.
Okay, thanks, guys. I think that's that's all the papers. We'll just do a quick break for lunch. 15 minutes tops. I'm sorry about that, but deal with it. And then we'll be back here in 15 minutes for the panel. The professors are already here. Welcome, welcome, sir. Thank you. Quick lunch and panel. Okay.
Swarna, sir.
Hi, am I audible? Okay. Hi everyone. Sorry we got a little delayed, but I think that was a great round of papers, and we'll just quickly move on to the panel discussion. I'd like to invite Professors Milind Chakraborty and Indranil Mukhopadhyay on stage, please. So, you can just. I think in general, as has been the norm all morning, we'll keep it intimate and informal, largely. Okay. We will commence with the discussion. It'll be brief 15-20 minute discussion on the social security and social policy making as an umbrella theme. And then we'll go into a little bit of granular details, wherein after that there will be a 10-minute section on question and answers. I personally think there, after today and this morning, there is a room for quite a bit of questions. So please feel free to go ahead. Before that, I'd just like to introduce the panel. Of course, they are the university's very own Dr. Milind Chakraborty and Dr. Indranil Mukhopadhyay. Dr. Milind Chakraborty has been has over 27 years of experience in macroeconomics, environmental economics, and has worked with various countries as an economic advisor. Professor Dr. Indranil Mukhopadhyay is proficient in health and public health and has worked with the WHO special group and a number of states in terms of the health policy. Without further ado, we are just going to jump into this. Guys, please feel free to note down your questions and ask that. Thank you.
Hello. Good afternoon and welcome to OP Jindal Global University. I welcome you. Of course, you were here for quite some time, even before I joined, but we have got a responsibility to formally invite you on behalf of JSGP and Jindal Global University. So both Indranil and me would welcome you to this event. And you had participated in making presentations of your observation on different aspects of social security and social protection. I was impressed that you not only covered the situation in India, you went beyond that, and you also brought in the exercises that were carried out in terms of Bolsa Familia in Brazil. So, okay, is it okay now? Okay. So the point that I feel is very important to understand the issue of social protection or social security, whatever way you look at it. These two terms almost mean the same thing, but they do not mean the same thing. I am not going into that detail here. But the point that is very important is to understand how the concept of social protection or social security emerged from a historical perspective. If you follow through the human history, till the emergence of capitalism, there was no differentiation between economic, social, and political identity of an individual. They were considered to be simultaneously taking care of their economic requirements, their social requirements, and the political requirements. Because they were not considered to be an independent unit who is ready to satisfy one's own satisfaction. They were still then considered to be collective groups of human beings, and they were to provide support to the rest of the communities as well. And this did not merit much concerned discussion on social protection, because social protection was a part of the system existing at that point of time. With the development of capitalism and with the development of the idea that each individual should maximize his or her own satisfaction, and that will lead to the maximization of social satisfaction, led to a situation where we tried to move away from our understanding of collective life and put more emphasis on our individual life. And it was argued that if I can improve my satisfaction, I can maximize my satisfaction, and if on the other hand, Indranil and Jashroop can also do the same thing, then if we three constitute a society, the social welfare will be maximized. Because the idea was that my utility, my satisfaction, my requirements are not dependent on what Indranil provides or what Jashroop provides. Because we are considered to be individualistic. And that led to the emergence of a methodology which is called methodological individualism, where we try to understand everyone as an individual and try to look at their activities. But as this was going on, there was an important time in the early 20th century, or even late 19th century, when industrial revolution settled down and some countries became much more productive, and they were in a position to extend their trade all across the world, they could realize that the difference between the owner of capital and owner of labor, that is the relationship between the reward for capital in terms of profit and reward for labor in terms of wage, was going a little disturbed in favor of the owners of capital and against those who are providing labor. But that was the time when the world was moving from an agricultural system to an industrial manufacturing system. And for the manufacturing system to sustain, it was not possible to consider labor to be always the loser, because they were also necessary for the growth of GDP and for the generation of development of the economic system. So this led to the emergence of the idea called social protection. People were given labor rights, they were given the right to trade union, and mind you, the first trade unions in the world did not come from a communist world. It came in USA. So the idea of providing support to the labor to capture their requirement to some extent was the main reason behind going for social protection. So the laborers were given protection in the sense they were given labor rights, they were given rights to strike, they were given rights to build their trade unions, and this way the social protection ideas got incorporated in the ideas of a nation state. But from 1990s, what happened? From 1990s, the process changed because now it was realized that the most important source of income and surplus is knowledge. And knowledge led to much more emphasis on the development of the service sector, which is no longer dependent on low-skilled or unskilled labor forces. They require high-skilled labor forces. And that led to gradual, I would say, disregard for social security in the entire world. It is not true even in developed country today. The level of social security is as high as it was 20 years back. Casualization of labor, then private supply of health and education services, they all started. It was there in America, but state service was also there. The role of state service gradually went down in America. The role of state service in education and health went down further in the rest of the Europe, and they say that they don't have enough resources to take care of that. And the reason behind is that these rich countries are no longer competitively advantageous position in terms of manufacturing. They do not care for manufacturing. They have become more interested in the service sector. And India got a very interesting role here. In India, agriculture was the main source of GDP till the time of independence. But what happened later? For about 20 years or so, there was slight improvement in manufacturing sector. But from 70s onward, the service sector emerged powerful and the manufacturing sector went down. So India never got a chance to think positively in terms of social security. Because when it was agriculture was the most important thing, there was no concern about social security. When service sector became the most important thing, social security is not considered that much relevant. And I am giving you an opposite example in terms of the trade union rights of the technology people, IT sector technical people. They were asked in 1980s by the existing trade unions to join them. And then they refused and said, we are not workers, we are technicians. But now when they are facing problems, over the last 2, 3, 4 years, they have now started developing their trade unions and they have asked for support from the traditional trade union movements as well. So the fundamental point that is to be understood in the context of social protection and security in India has to be looked from this perspective, that the importance of manufacturing sector led to the growth of the idea of social security and social protection. And if manufacturing is going away, then it is no longer possible for a country like India to introduce social protection for 140 crore people. The point is that if India has only one option left to introduce social protection and social security by encouraging growth of industrial manufacturing sector. If that can be done, then social security or social protection the issue of that can be taken up in a much more broader sense. I think I should stop here now, give it over to Indranil, whatever he has to say.
Thank you, Professor Milindo. I have a few data, so I'll use slides. So PDF, SHP, yeah. इसको थोड़ा बड़ा कर सकते हैं. Thanks. I think, as always, Professor Milindo has brilliantly captured the history of capitalism and the relevance of social protection in a very short presentation, and also talked about the the economic liberalization phase and how the informal sector has grown in this period of time, and the need for expansion of manufacturing and formal sector employment and social health protection in that context. What I'm going to do is I'll share some data on the state of social protection and focus more on social health protection as such, because that remains a very critical element, health and social security, all of this together, and put a bit of emphasis on two directions, policy directions in India. So let me give you a glimpse of the broad policy direction that we see. On one hand, if you look at health and social welfare policies related to health, there is on one hand, there is this employees state insurance scheme, the ESIs scheme, which is for formal sector workers for up to a certain annual income, monthly income. That's one way of expanding social health protection. The other approaches have been, on one hand, expansion of publicly provided services in general and as a way of ensuring social health protection. And in the current context, a particular kind of programs which are called government-funded health insurance schemes as a means to expand social health protection to informal workers, and particularly people below poverty and marginally above poverty, largely informal workers. And I'll give you a bit of comparison of how these two strategies work and some of the positives and negatives and what is the way ahead for us in future. And when I'm saying way ahead, I'll draw from some of the demands the trade unions, the informal sector unions are putting on table. Okay, we know the context, and if the current the COVID actually brought out the extent of vulnerability of large section of informal sector workers, and there are estimates which suggested that during the COVID time, during the first lockdown, at least 40 crore people were brought down below poverty line. And there, of course, there is a lot of debate around that, but it was largely, and in particularly in urban areas, people in informal workers, they were particularly vulnerable. Now, main reason of this kind of vulnerability is lack of social health protection, but also coupled with very low levels of wages. And if you look at periodic labor force survey data, you'll see that on an average, people living in rural areas spend 85% of their earnings on consumption, just to meet current consumption needs. And among the agricultural workers, which are the vast majority of workers, almost 97% of their earning goes into meeting current consumption. So there is virtually very little space for this vast section of informal workers to be able to have some savings, to be able to meet any health crises or any crisis in the family debt. So that's the extent of vulnerability that we have. And if we quickly look at the workspace, there are 4 kinds of workers if we look at Indian context. There are informal workers working in the informal sector who constitute 87%. Then there are formal workers in the informal sector, very few, but around 7% of them. And then we have the informal employment in the formal sector. And this has really grown in the period of neoliberal reforms. And then we have a very small formal employment in the formal sector. And current designs of ESIC and other social health protection programs largely focus on this. And this is part of the workforce. And there are some associated numbers, but another key point is even in terms of enterprise, if you look at the size of the enterprises, because our social protection, health protection, ESI kind of schemes work on size of employment, right? A large majority of these are 5 or smaller, employ 5 or lesser number of workers. So that's the context. And as a result, we'll see that in rural areas, 46% of 46% of workers feel that they are not even eligible for any social health protection. In total, less than a fourth have some pension, PF, and some kind of health protection. Only a fourth of the total workforce in the country. So, I'll skip this. Okay. Look, this table could be a bit jarring, but I would like to point out that if you look at, say, the third column, the employer-supported programs, and here we are looking at health protection schemes, only 0.8% of the total workforce in the rural areas have some kind of employer-supported health protection. And this is 2007 and 18 NSSO data. The percentage increases in the urban area to 6%, but essentially 86% of the rural population and 84% of the urban population, I think one column is missing, which do not have any coverage of health protection. Now, that's the reality under which we are living, and that's where there is a need, 2 things. At one hand, we need expansion of programs like ESIC, but at the same time, we need expansion of generally publicly provided finance and provided services. If you look at how does social health protection improves your access and health seeking behavior, if you look at it, you'll see that regular wage earners actually seek more health care compared to those who are, say, in agricultural labor or other casual work. And when I'm saying both for outpatient and inpatient care, it's not that they are not falling ill, but even if they fall ill, they're not seeking care. That's the state of affair in the country. As a response, we have, like I said, the ESI scheme, ESIC, and we have seen that over the years, there is a number of insured persons. These are actually the workers. The numbers have increased over the years. But still, a lot of the people in the formal sector, in relatively formal employment remains uncovered, even in the current design of ESIC. The irony is this, I am not going to explain this graph because it takes time, but the basic point is ESIC has a huge surplus which remains unused. There is a lot of potential because over time there is a coverage expansion, and now if your monthly income is 25,000, you're covered. A lot of people are mandatorily contributing, but then much of that contribution remains unspent. So there is a huge potential to expand the coverage without having huge financial burden on the system. That's one point. And of course, there is some increase in the hospitalization rate, but then you will see even for ESIC, bed per 10,000 beneficiaries are going down. So there is also rapid scope of improvement in this. This is again a bit, I don't have the bandwidth to explain this, but I'll just highlight that, you know, employer-supported programs actually are able to protect people better only when, say, the cost of care, if you go and spend, you have to spend money from your pocket, that can be protected only when people with insurance or ESI protection goes to public services or ESI empaneled hospitals. When they go into private sector with card, be it PMJ or be it ESIC card, they are forced to spend a lot of money from their pocket. And that's the reality. So in that context, we need to design our expansion of social health protection. And this is a very interesting graph. It's from a primary survey that it's actually the ESI beneficiaries, if they go to public ESI facilities, they get best kind of financial protection. Okay. And when we look at, say, in comparison, when we look at those who are going to under PMJ kind of schemes, Prime Minister's Jan Arogya Yojana kind of scheme, and they go to private sector hospital, they end up paying a lot of money. More than 2/3 spend 10,000 rupees on an average or more. So effective financial protection is not being realized even in these. Only if you go to public sector hospitals, you can get this realized. So the point here is this is in terms of a separate indicator, which is catastrophic health spending, which means 10% of, are you spending more than 10% of your consumption on health? There also you'll see if it is ESI, then only you get reduced catastrophic instances. So basically, if we just put this, how much time I have, Yashu? Okay. So the point, okay, this also the key point for us is that we need to expand ESIC, we need to expand ESIC to all districts of the country, we need to include all unorganized sector workers, even enterprises which are small, relatively small, but we need different design for their expansion. I'm coming to that point. But one important element of health protection is the need for primary care. Primary care is the basic services that you need when you fall ill. What is happening in the current design, both in the ESI kind of design and also in the tax-funded health insurance programs like PMJ, the focus is on secondary and tertiary care. You know, out of 100 people needing health care in a particular period of time, 90% would need primary care. If you take care of the primary care needs, your social health protection needs can be largely catered to. So what is needed is, within ESI or within other public provisioning, expansion of primary care. This I'm skipping. This is a famous UHC scheme. I've discussed the surplus that we have, and a lot of this surplus can be used to expand primary care. It's very simple. Say our ESI hospital, there is say this Rai industrial area, if any of you are familiar, do not have a ESI dispensary, and more than 50,000 workers are there. The ESI dispensary is 10 kilometers away. Now, a worker cannot give away her daily wage to go for a ESI hospital 20 kilometers away when the ailment is not a major one, unless they're pushed out of work because of the nature of ailment. So smaller ailments create a lot of financial burden, which our current design is missing, and we have the resources to finance those. There are lots of those challenges remain to include informal workers. One is, often many of the workers, as you would know, do not have a permanent employer. I'm working with somebody today, I can go to somebody else. What do you do in that context? The eShram card is a major expansion in this. And if you look at eShram data, large majority of those who are getting enrolled in eShram are actually Dalits, OBCs, marginalized sections of the society. Now, they need to be covered for their primary care needs as well as their secondary and tertiary care need in order to be able to provide adequate financial protection. Then there are domestic workers, how to include them. There are often, there is also in the labor code, some of these issues have been discussed, but say gig workers, the new sector of workers, sometimes say plantation workers, the beery workers, there are particular pockets of informalization in the formal sector that needs to be addressed in the expansion of ESIC or any other social protection. So there are, if we look at number of type of workers, within ESI there are registered workers who are not enrolled within ESI. There are eligible workers who are not registered within the ESI. There are unorganized workers, but organized workers, but they are not eligible. And then there are unorganized workers. So we need to devise differential strategies to include them into a single design of social health protection. And this design cannot be based on their employer and what their employers are willing to contribute, because that remains a major barrier. The kind of compliance, the last point I'll make, in the last 20 years, the nature of compliance with ESIC enrollment has gone down significantly. Compliance has been made voluntary. So we need to rethink about strategies to actually expand social health protection to the large section of workers. But here, as I would say, just to conclude, that this needs multiple strategy and mixed strategies, but a lot of emphasis needs to be on strengthening general publicly provided services, because and primary care services, because that remains the backbone on which health-related social protection can be ensured for a majority of workers. Okay. Thank you. I would really like some questions, and both of us will try to answer. Thank you so much.
Thank you, Indranil. So that was very exhaustive. I think before I throw it to the audience, I just have one question that merges a little bit about what both of you said. I think from the conversation largely comes across that, one, there is a collective bargaining vacuum a little bit when it comes to social protection in India, in the sense the identification of beneficiaries, the identification of the needs of beneficiaries because of the demographic breakup in employment and the different bargaining power of the demographic breakup. And as a contextualize that against the coverage challenges, which are implementational across federal lines, which is, it's not just the burden of the center, it's the burden of the state and in conjunction with each other. So, in your opinion, what is the future of merging this conflict? The bargaining and the identification problem, which then translates into expansion.
Well, this is a question which really needs to be answered. And my personal observation in the context of the public policy making process is, as long as we keep this public policy making process as an intellectual practice, nothing will happen. Public policy has to be incorporated into the political and social processes. And we have very confidently, we have very seriously being given the expertise on public policy making, we have kept that outside the purview of those who has to join socially and politically. We think that we can only make policies and we can ask others to follow it. This is the fundamental problem. There is a recent book, I forgot the name of the author, where he argued for the entire globe. There are practices of constitutional democracy, meaning the constitutions are designed to be democratic, but most of the countries are not following political democracy in the real sense of the term. The policies, the activities, practices are decided by, not for the people, by the people, of the people, but it is decided by a small section of the elites, for the small section of elites, and by the small section of elites. So there is a huge gap between what our constitutions say in the name of democracy and what we are practicing in the world, be it in America, be it in India, be it anywhere, what we are applying as democracy and what we have claimed to be as constitutional democracy, they are vastly different. So if these issues are to be taken into account, we have no other options but to engage all the stakeholders in the policy-making process. You just can't have an expert committee and decide on the policies and then say that if you have any objections, come out with your objections within 21 days. If you don't have it, we'll accept it. This should not be the process. And the second point that I find with most of my students, when I argue this in this way, they say, sir, it will take a lot of time. I said, yes. Policy cannot be made in one day. You have to give time to find out as to what are the effects of that policy and how different individuals and stakeholder groups are reacting to that. If you don't do that, if you say for example, I am fully in agreement with Indranil as to whatever is required to improve the social protection in health sector. But if I ask him very frankly and very intimately, if I ask him, that do you think you have said anything new? This is being said for the last 15, 20 years. Maybe some numbers have changed. But it is being said, but nothing is happening. The reason is that it is decided by a group of people who do not constitute the whole community of a country, or in some cases, it should be global community as well. So this is my observation. Thank you.
Shall I respond to the same question?
Yeah. I wanted to ask about increasing expansion and what is the future of increasing expansion like in your...
So, if we look at, say, what have been the approaches, and traditional approach has been that social protection through work, work as a major entry point, and accordingly you had strategies. And we see that the work space is shrinking, workspace is transforming, work has now got into your home, and in this design, a lot of women, if you just go by employer as an entry point to social protection, lots of women are being left out and a lot of marginalized section workers. So, not that I'm saying again, this is not new, but the approach to social protection has now changed from work to population-based strategies. That's one, and that's where I think we need a lot more resources and thinking. Problem is that even within that approach, we are trying to say if you look at the cash transfer vis-a-vis, which is being called freebies, and compare that with concrete provisioning of services. Now, when you provide, free education or health or food, you are deciding on behalf of people that these are important things. And there is some kind of paternalism involved in this. But then, can we call them freebies? Because the idea of cash transfer is that you give it to people and let them choose. And But what has been the experience of even in Mexico or Brazil is that a lot of this cash transfers have worked because there were universal public provisioning of basic services. And then only some of these have worked better for people, for the most marginalized who do not even have the means to, even take the Indian context. One of the major schemes, the Janani Suraksha JSY Yojana, which was a conditional cash transfer for women who could deliver. The program worked relatively better because you also backed it by a program to free provisioning of maternal care at the institution. And I think that is an approach. When you are going into population-based strategies of social protection, you cannot leave it to the market to provide the supply side and you just back it up with demand side. It has to be a concerted strategy of both supply and demand side. Now, the point about how do federal structure and what are the limitations. Of course, Indian constitution has limitations. We know the resource mobilization space is largely with the center, and even with the introduction of GST, the space for states to take their own resource mobilization strategy is getting shrunk. Now, in that context, it would get increasingly challenging. If you look at Indian scenario, many states are actually taking up major expansion of social protection and trying to navigate that space and that contestation between demand and supply, or say resources. One key problem in this, when center introduces a program, say when center started the PMJ or say national, say any other centrally sponsored program, states are asked to complement with funding. Shall I call complement or supplement? Supplement. You match up grants. But when a state takes an initiative, say Right to Health in Rajasthan, there is no obligation on the part of the union government to support it. So this is going to bring out new challenges in the way fiscal federal space is being thought through in India. And that's where probably there is some need for rethinking on GST or a major transfer through Finance Commission to states on specific aspects of social security without much conditionalities. I think these are some of the ways through which this can.
Thank you. Thank you, sir. I think we'll open it to the audience now. Anybody? Questions? Okay.
All are tired. Too tired to raise questions.
No, okay. I think fine. That works.
I have one comment
Yes.
to make. Because I have been offering a few courses on design and evaluation of programs and policies to my master's students. And this is one of the points that came out very clearly, and that was also what was mentioned by Indranil. Bolsa Familia in Brazil and some of the activities in Argentina and Mexico, they were successful. Many things have been said, but one thing is almost always left to be missed out. The point is, all these programs were decentralized at the municipality level. They were not made by the central governments. The programs were implemented at the decentralized level at the municipalities. There were an umbrella instruction as to how to do them, but everything is implemented by and maintained by people at the municipality level. This is almost every time never mentioned in any document by World Bank while they highlight the success of these programs. Cash transfer is not successful if it is not decentralized. And decentralization means involvement of local level politics in policy making and program designing. Otherwise, you cannot have programs designed at the central level and then let them move downwards as per your wish. So this is what I want to make as one of the observations. Thank you.
Thank you, Milind sir. Thank you, Indrajit sir. I think in summary, I think we can just understand that in general, social protection works once the missing markets of general provisional requirements, so like general health infrastructure, general education infrastructure, that the things the market won't auto-correct, so to speak. Once those are met, then we can think of expansion of social protection in a meaningful and efficient manner while keeping it decentralized. On that note, I think that's been very enriching. Of course, we had a whole morning of the papers and we will receive your comments on them later as time progresses. On that, I think I would just like to hand it to Hemlata ma'am to close the proceedings.
So thank you so much for the team SPRF to have such a wonderful session in today. Though on the note from the JGU side, I would also like to mention thank you to Professor Milindo and Professor Indranil for making the event so successful and sharing their thoughts on such wonderful ideas on the health side of it and the social security. I also would take a chance to ask a question on behalf of my personal, interest into the primary healthcare, as Professor Indranil did mention on the topics and the importance of the primary healthcare centers, and there are a lot of challenges. So my question to the SPRF and similar set of organizations is that how long will we be talking about the importance of public policy implementation into the areas of the, not covering on the primary healthcare centers? How long will we be only saying that primary healthcare centers is organizing the, ICAMs in the social, the beneficiaries in Pan-India? So again, that's a question which actually always comes to our mind when we are trying the implementing of the projects and we are monitoring that. But thank you so much again to Yash, Soumya, Fahad and Somnath from the team of SPRF for such a lovely session and conducting. I would also like to thank all the participants coming in from different universities and taking their time in and presenting their papers. Best of luck for the results. I'm sure that you're already eagerly waiting for it. But thank you so much again. I would request professors to felicitate the team of SPRF. Professor?